260 recalls today, so you can understand one thing, we have to be a little bit faster. But rheumatology is an interesting subject. So do I have your support today to be a little rock and roll, recall discussions? Yes. All right. Yeah. So a lot of CSS are there. We'll go faster. We'll do bulk today. Okay, we'll do more bulk today. So we'll go a little faster. Of course, you have a pen, paper, or notepad, whatever, so that you can write down the right answers and the relevant file. I think already we have posted in the group actually, or you can check it after class. So the recall file we have already posted actually. All right, great. Good to have all of you. Thank you so much for attending the recall session. We're going to start now actually. Yes, and we do have almost 60 questions today, so we have to be a little bit faster than some of the other days actually. Okay, let's do a bulk and let's go and start a 40 years male. Even the rheumatological, most cases female bodies. This is a male with rheumatoid arthritis, MTX, and a lot of drugs are quite common in the planning to start family. I talked about something last day, something like this. What is your advice? Check the question, quickly go for an answer. Yes, please. Okay, I can see my doctors are really fast in terms of handling. So stopping the methotrexate, continuing with hydroxychloroquine. Let's find it out. Yes, it's the right answer. Well done, guys. Yes, it's a right answer. This is right. Because why methotrexate? Of course, we don't appreciate. Methotrexate is something we don't appreciate. If you are thinking about family planning, and all these things. Do remember one thing. Other than this methotrexate, there is another drug we have mentioned, that is the sulfasalazine. Another drug we have mentioned, that's the sulfasalazine. So sulfasalazine and the methotrexate, these are the two things, may not be the best choices actually. Okay, all right. Okay, so summary, hydroxychloroquine could be relatively safe source, Davidson's medicine. I think we have seen that Davidson chart was, right guys? Remember, we have seen that Davidson chart was, or which are relatively safer in pregnancy. Have you checked that note, guys? Rheumatology, there was a SM note. Yes, well done. Great. Next one. All right. Similar pattern. Patient with a RA, rheumatoid arthritis, then some drug names are given. There's some complaints are given, pain and labs are given, and they are asking for which is the possible reason of causing these symptoms. We have ELT, AST, GGT, bilirubin, all elevated. Now, when these particular things are elevated, is it a method-induced hepatitis or autoimmune hepatitis? Now, autoimmune hepatitis, you need an particular type of autoantibody. So I think C is not an answer. You need a particular type of autoantibody for calling autoimmune hepatitis. So that's a wrong answer here. So this is again. So this is individually a topic. Drug-induced hepatitis. If you see the Davidson's medicine, you will find this topic, or you can also Google it. For this topic, drug-induced hepatitis. Now, do you agree with drug-induced hepatitis cases? Any hepatitis cases, ALT, AST will be increased. Agreed? Any hepatitis or any liver injury, this ALT, AST is agreed. Okay. Now, GGT is raised more in case of drug-induced cases or there are some biliary cases. So drug-induced cases and some biliary cases. We'll also think about GGT rates. Maybe also you can consider alcoholic cases too. Alcoholic cases actually. But I think only GGT rates, and first we look forward to if the person is taking any drug. So that drug is the first priority. Drug is the first priority if GGT is raised actually. Now why it's not ALT and AST? Because if it is why it is not alcoholic hepatitis, they will tell you AST, ALT like a 2:1. Okay.
ALT to
ALT
AST is the 2:1. The first one's
The
answer
first one's
someone asked
answer
was the
someone asked
A,
was the A,
and this one's
and this
answer we
one's answer
also
we
as
also
a A.
as
So
a A.
alcoholic
So
is out,
alcoholic
and
is out,
they didn't
and they didn't
mention
mention
anything about the
anything about
alcohol.
the alcohol.
Nothing is mentioned
Nothing
here,
is
so that's
mentioned here,
also
so that's
out
also
actually.
out
You
actually.
can understand.
You
So
can
this is
understand.
going
So
more
this is
towards
going more
by
towards
exclusion method.
exclusion method.
By
By
exclusion method
exclusion method towards the
methotrexate
methotrexate-induced
hepatitis.
hepatitis. Okay.
So drug-induced
So drug-induced
hepatitis,
hepatitis,
ALT,
ALT, AST,
digitirates, no
digitirates, no
autoantibodies, so
autoantibodies, so
autoimmune are out.
autoimmune are out.
And no
And no
AST more than
AST more
ALT
than
2 is to
ALT
1
2 is to
not
1
there.
not
So
there.
alcoholic
So
is out.
alcoholic is out.
Alcoholic
Alcoholic
hepatitis
hepatitis
also
also
has
has
few
few
unique
unique
feature.
feature.
Maybe
Maybe
in
in
another
another
class
class
we
we
have
have
mentioned. Do
mentioned.
you remember
Do you
about those
remember
features?
about those features?
Alcoholic,
Alcoholic,
hepatitis or
hepatitis
alcoholic,
or alcoholic,
liver disease has
liver
some
disease has some
particular one.
particular one.
Yes,
Yes, starting with
gynecomastia,
gynecomastia,
bilateral
bilateral
parotid
parotid
enlargement,
enlargement,
not
bilateral,
unique,
not
bilateral
unique,
parotid
bilateral
enlargement, two
parotid
patterns
enlargement,
contracture,
two patterns
two
contracture,
patterns contracture,
right?
spider
Right?
native.
Spider
These
native.
are some of the
These are some of the
specific to the
specific to the
alcoholic hepatitis.
alcoholic
Davidson has
hepatitis.
a
Davidson has a
nice
nice
chapter regarding the
chapter
alcoholic
regarding the
hepatitis.
alcoholic
If you want, you can
hepatitis. If
have a
you want,
look
you can have
actually.
a look actually.
Okay.
Okay.
Yeah, palmary
Yeah,
reactions.
palmary reaction.
So methotrexate
So
induce some of the
methotrexate
side
induce some of
effects.
the
Maybe
side
this is,
effects. Maybe this
if
is,
you Google, you will
if you
find
Google, you will
many
find many
informations like
informations
bone
like
marrow,
this.
GIT
Bone marrow,
here,
GIT here,
alopecia. Bone marrow is one of
Bone
the
marrow
very
is one
important.
of the
That's
very
why
important. That's why
methotrexate can cause
methotrexate
really
can
big
cause
side
really
effects
big
in
side effects
anyone.
in anyone.
Okay, moving
Okay,
to
moving
our
to
next question.
our next question.
Now we're going
Now
quick.
we're going quick.
We remember
We
rheumatoid
remember
arthritis
rheumatoid
are more
arthritis
related
are
to
more related to
articular
articular
symptoms, but there are a
symptoms,
lot
but
of
there are a lot of
extra-articular symptoms
extra-articular
too.
symptoms
Like it
too.
can affect
Like it can
heart,
affect
it can
heart,
affect
it can affect
neuro, it can
neuro,
affect
it
many
can
other
affect
things. Now,
many
which
other
of the
things.
following
Now, which
not
of the following
considered
not considered
extra-auricular
extra-auricular
manifestation of
manifestation of
arthritis?
arthritis?
Peripheral
Peripheral
neuropathy
neuropathy is
actually a cause
actually a
because
cause
if you
because
see the
if you see the
if
neurological,
Davison
if
has a lot of
Davison
chat
has a lot of
boxes,
chat
maybe
boxes,
you can
maybe
have a look
you
for
can have a
the
look for the
extra-articular manifestation.
extra
Now, this
articular
kind of
now these
questions
kind of questions are more
are
mainly
asked to
are
see
asked to see the
how deep is your
how deep is
knowledge
your
about
knowledge
the
about
exam
the
actually. Like
exam
some are
actually. Like some
conceptual,
are
like
conceptual, like
investigations,
investigations, like
step of
step of
management, best
management, best
approaches,
approaches,
risk factors. These
risk
are
factors.
the
These are
conceptual
the
question,
conceptual
authentic
question,
and
authentic
regular
and
question. But
regular question. But
when they ask this
when they
kind of
ask this
question,
kind
then
of
it
question,
means
it
they
means
wanted to see
they
how
wanted
much
to
you
see
have the
how much
hold
you
on
have
the
the
book.
hold on the book.
Okay, now question
Okay,
is
now
coming.
question is coming.
Are you expecting
Are you expecting
hepatomegaly?
hepatomegaly?
I don't remember
I don't
anything
remember
related to
anything related to
hepatomegaly with
hepatomegaly with
rheumatoid arthritis.
rheumatoid arthritis.
Okay, so I think it's
Okay,
a
so I think it's a
hepatomegaly. Okay, so
hepatomegaly.
that's also
Okay,
it's
so
a
that's
not
also it's a
considered.
not considered.
Not considered.
Not
So this
considered.
is the
So
answer
this is the
actually.
answer actually.
We also
We
remember it
also
can
remember
also
it
affect
can
the
also
lung, it
affect the
can
lung, it
also affect
can
the
also
blood
affect the
cell,
blood cell,
like Kaplan
like
syndrome,
Kaplan
Fenty
syndrome,
syndrome, many
Fenty
other
syndrome,
things.
many
So are
other
there.
things are
Have a
there.
look on the
Have
John
a look on
Mota.
the John Mota.
For more
For
extension, you
more
can see the
extension, you can
Davidson
see
chat
that
books. They
Davidson
have a
chat books.
separate
They have a
box
separate
regarding the
box regarding the
extra-articular manifestation
extra-articular
of rheumatoid
manifestation of
arthritis can
rheumatoid
be
arthritis can
helpful
be
actually.
helpful actually.
A quick question.
A quick
Is
question.
carpal tunnel
Is
syndrome
carpal
is a
tunnel
clinical
syndrome is a
feature?
clinical feature?
Let's see your ideas.
Let's see your ideas.
Is carpal tunnel
Is
syndrome
carpal
is a
tunnel
clinical
syndrome is a
feature
clinical
of
feature
rheumatoid
of
arthritis?
rheumatoid
Answer.
arthritis? Answer.
Yes.
Yes.
Just checking.
Just checking.
Not only carpal
Not
tunnel
only
syndrome,
carpal tunnel syndrome,
tarsal tunnel
tarsal
syndrome as
tunnel
well.
syndrome as well.
One in a hand,
One in a hand, one in a
the
you know
foot
the
area.
foot
So,
area. So
just checking your
checking
health
your
knowledge when you
health
say
knowledge.
both.
When
That
you say
means
both, that
some
means
of you have seen
some
the
of you have
Davidson
seen the
book soil,
Davidson
some
book
of you
soil,
didn't.
some of you
So
didn't.
maybe
So
you can check
maybe
that
you can check that extra-articular manifestations
of rheumatoid
of
arthritis.
rheumatoid arthritis.
Next question.
Next question.
50-year-old
50-year-old suffering
as well for
as well
rheumatoid
for
arthritis.
rheumatoid
Classic
arthritis.
question.
Classic question.
Treated with
Treated
this
with
particular
this particular drug,
and in 3 years
and in
develop
3 years
peripheral
develop
neuropathy.
peripheral
This is the
neuropathy. This is the
neuropathy
neuropathy
likely to cause. Now,
likely
this
to
is
cause.
a
Now, this is a
different question.
different
Actually, this
question.
question you
This
don't
question you don't
much always
much
expect.
always
Most of you
expect.
will be
Most of you will be
answering E, but
answering
this
E,
one's
but
answer
this one's
actually is a
answer
C.
actually is a C.
Okay, so this one is a
Okay, so
little
this one is a little
bit
bit difficult level
development
question.
including
Development
arthritis
including
in
arthritis in
rheumatoid
arthritis in rheumatoid arthritis.
So
So
how this one?
how
I mean,
this one? I mean, I
publication, because
this was not present
in any
in
book
any book actually. So
as you all can
as you
see,
all can see,
here's some reference
here's
for
some
that one
reference for
actually.
that one
So
actually. So
nectarizing
nectarizing
atarachids
atarachids
um,
um,
can
can happen in rheumatoid arthritis. This can explain some of the situations like 50 years of rheumatoid arthritis have been treated with prednisolone for 3 years. After, like much later, they develop peripheral nerve instability. This neuropathy can be because of necrotizing arteritis. So this one is learned as a learning, as a conceptual learning, or as a new concept. Please check this question again. So someone who develops rheumatoid arthritis even though with prednisolone, but later developed peripheral neuropathy. So this can be necrotizing arteritis. Maybe you can take a picture of that one. If someone wants to deep down or go into the mechanism, you don't need much mechanism because this is a very unusual thing. But there's some chronic condition which can lead to this particular situation can happen actually. If you want to go through the mechanism, pathophysiology, these are some of your lines can be. But normally I don't recommend because it's an unusual question actually. Alright. I'm holding here for 10 more seconds. You need to take a snap because it's not a usual question, so I didn't put it in as a note actually. Good. Next one. 50-year male with a pain in the knee, several knee joints and small hand joints. She has a history of morning pain, lift with activity, right knee joint swelling, and thick effusion. She's on some medication. Many exam will tell you the medications. Now, what is the? She's 50 year and knee pain. Morning pain means probably stiffness. Going into that one. Anyone can tell me what is the diagnosis. In terms of diagnosis, is it a gout or a C2 gout you are thinking? So whatever it is, we are going for a painkiller. Now, this is already probably a defective joint. Did you see that? 50-year female with a pain in the knee, swelling of the knee and a small joint. So and she has a morning pain and stiff and this that actually. And later on there's a right knee swelling. So there's a previously something present, which on the top something is present actually. So the person is probably already having a defective joint. Now, on the top of already defective joint, there's a possibility of development of pseudogout. Did I mention this thing last time? In a defective joint, two conditions can develop. I repeat my things again. In a defective joint, two conditions can develop. Okay, what are those? One is septic arthritis. But septic arthritis will have big time fever, local warm and tenderness. That is the thing. So pseudogout is, I think, more appropriate. I repeat, pseudogout would be a bit more appropriate in that particular case actually, compared to the regular gout actually, right? Acetogout, probably. I mean, first of all, it's a defective joint, and let's say osteoarthritis is more common than the rheumatoid arthritis. That is why if you want to make a interlink, in which cases pseudogout is more common, my answer would be in that case osteoarthritis would be more common actually. In that case, osteoarthritis would be more common actually in that particular cases. Naproxen because the severity of the pain looks much more difficult at this point actually. See, when it is said already someone has a defective joint and this that, it means many of the drugs are probably being used. Am I right? If you think that there is already defective joint, that means already a lot of painkiller has been used. So paracetamol may not be the best solution in that case. So it's more this kind of terms matters. If pre-existing joint and this that not there, and if it is a typical case of osteoarthritis for the very first time presentation, in that case, it's a possibility that your answer can be paracetamol.
Good question. Someone
Good question.
mentioning
Someone
GI
mentioning
ulcer
GI ulcer
is mentioned.
is
In that
mentioned.
case, you
In
need to
that
go
case,
for
you need to
probably
go for
tramadol
probably
hydrochloride
tramadol
or some
hydrochloride
other
or some
painkiller you
other
need to
painkiller
choose
you
in
need to
that case.
choose in that case.
Because you cannot
Because you
choose any
cannot choose
sides when
any
someone is
sides when someone is having
or
or
steroid if someone is
steroid if
having
someone is
ulcers
having
actually.
ulcers
Okay. So
actually.
you need to
So you need
choose
to
something
choose something
alternatives actually.
alternatives actually.
Well done.
Well done.
Next question.
Next question.
Rheumatoid arthritis or
Rheumatoid
10 years,
arthritis
so
of 10
again,
years. So
equally
again,
case. So
equally
rheumatoid
case. So
arthritis, that's
rheumatoid
why we had
arthritis,
a
that's
very
why we
big
had a
note
very
actually.
big note actually.
Sudden pain for two
Sudden pain
days
for 2 days
and two
and
fingers that
two
is turned
fingers
out
that
to
is
be
turned
black.
out to be
Maybe
black.
rheumatology,
Maybe
Raynaud changes
Raynaud
possible.
changes possible.
What investigation
What
lead you to make a
investigation lead you to make
diagnosis?
a
Come on,
diagnosis?
guys,
Come
you
on,
need to be
guys, you
faster
need to
on
be
this one.
faster on this one.
Finger that
Finger
turn
that turn
black color.
black
Okay.
color.
Many are
Okay.
going
Many
with
are
a,
going with
some are
A,
going
some are
with
going with
D.
D.
No, we are going
No,
with
we
the
are going with
anchor
the
here
anchor
actually.
here actually.
All right. Now
All
what
right.
just has
Now what
happened
just
here?
has
Let's just
happened
see.
here? Let's just
Now
see. Now
it should be
it should
anchor.
be
Why?
anchor. Why?
Because
Because
vasculitis is an
vasculitis is an
extra-articular feature
extra-articular
of
feature of
rheumatoid arthritis. So you
rheumatoid
can see
arthritis. So you
here
can
that
see here that
extra-articular
extra-articular
manifestation related
manifestation
questions
related questions
can be asked.
can be
Extra-articular
asked.
manifestation. So
Extra-articular
because
manifestation. So because
ANCA is more
ANCA is
related
more
to
related to
vasculitis. As I
vasculitis.
mentioned,
As I mentioned,
don't be sad for
don't be
this one
sad for
because
this one
this is
because
something
this
a
is
little bit
something a little
the
bit
difficult
the
ones. I
difficult
mean,
ones. I mean,
the easier
the
ones which
easier
everyone
ones
can
which
answer
everyone can
is
answer
initial
is
test,
initial
best
test,
test, best approach,
best
risk
approach, risk
factors.
factors.
Yeah.
Yeah,
You must be knowing
you
about
must be
that one
knowing
that
about that one that
rheumatoid
rheumatoid
arthritis,
arthritis,
SLE,
SLE,
Sjogren's, many other
Sjogren's,
condition
many other
can be
condition can be
associated in some
associated in
cases.
some cases.
Possibility with
Possibility with
Raynaud's
Raynaud's
possibilities of
possibilities
especially
of especially
rheumatoid arthritis
rheumatoid
things can
arthritis
be
things
related to
can be related to
vasculitis.
vasculitis.
Rheumatoid arthritis
Rheumatoid
turned
arthritis
into
turned
probably
into
black color.
probably black
So
color.
that's why we are
So that's
guessing
why
can
we are
be
guessing
rheumatoid
can
things
be
can be
rheumatoid
there.
things can be there.
But
But
mainly this question,
mainly
I
this
mean,
question,
indicating
indicating
towards the
towards the
vasculitis. So please
vasculitis.
remember
So please
rheumatoid
remember,
arthritis
rheumatoid
and
arthritis
vasculitis
and
has
vasculitis
close
has close
associations, right?
associations, right?
Rheumatoid arthritis
Rheumatoid
and
arthritis and
vasculitis are having
vasculitis are
close
having
association.
close
Can
association.
anyone tell
Can
me
anyone
rheumatoid
tell me
arthritis
rheumatoid
has close
arthritis has close
association with which
association with
eye
which
condition?
eye
So
condition?
if your system
So
will
if your
go here are
system you
some
go, there are
rheumatological
some
association and
rheumatological
they can ask
association and they
anything
can
like
ask
that.
anything
So
like
a
that.
quick question
So a
here,
quick
rheumatoid
question here,
arthritis has
rheumatoid
close
arthritis has
association.
close
So with
association.
which
So with
eye
which
condition
eye
actually?
condition actually? Um,
Okay, I'll give you
okay, I'll give
options.
you options.
Uveitis,
Uveitis,
scleritis,
scleritis,
episcleritis.
episcleritis.
Okay, final
Okay,
answer,
final answer,
scleritis.
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 Final answer is
Final answer is
scleritis. Mostly question
scleritis.
comes from
Mostly
that,
question
but
comes from that,
some
but
evidences
some
show is
evidences
the
show
uveitis.
is
So
the
if you have
uveitis. So if you
still
have still
scleritis,
scleritis,
no right answer,
no
but
right
uveitis
answer,
is
but
also
uveitis is
not
also
wrong. But if you
not
say
wrong. But if you say it
scleritis,
is
it's
scleritis, it's
probably not the
probably
best answer
not the
actually.
best
So
answer
best answer
actually. So
is a
best answer is a
scleritis.
scleritis.
Scleritis has
Scleritis has
strong
strong
association with
association
rheumatoid
with
arthritis.
rheumatoid arthritis.
Uveitis also has
Uveitis also has
association in
association in
passive way,
passive way,
and
and
episcleritis also
episcleritis
has
also has
connection in passive way, but
connection in
scleritis
passive way,
has
but
a direct
scleritis has a
connection
direct
actually. Okay.
connection actually.
So anyways, summary
Anyways,
here,
summary here,
vasculitis, part of
vasculitis,
rheumatoid
part of
arthritis,
rheumatoid arthritis,
ANCA, positive.
ANCA,
Clear
positive.
everyone this
Clear
thing.
everyone this thing.
Vasculitis, part of
Vasculitis,
rheumatoid
part of
arthritis,
rheumatoid
extra-articular
arthritis, extra-articular
manifestation,
manifestation,
presentation,
presentation, I mean,
lab
as a
test,
lab
ANCA
test,
positive.
ANCA positive.
Okay.
Okay.
All right. We do have a question.
We do have a
As
question.
you guys can
As
see,
you
I
guys
mean,
can
this
see,
one
I
I'll
mean,
not
this one I'll not
read. You guys
read.
read because
You
it's
guys
a
read
similar
because it's
type
a
of
similar
question.
type of
Just a
question.
little bit
Just a little
variation
bit
compared to the
variation
previous.
compared to the previous.
Quick answer is
Quick answer
required.
is required.
Yes, please.
Yes, please. Now,
Waiting for a final
waiting
answer.
for a
10
final
seconds
answer.
are
10
done.
seconds are done.
Best needed to be
Best
answered.
needed to be
Labs are
answered.
given.
Labs
Focus
are
on the
given.
lab.
Focus
Last
on the
chance,
lab.
guys.
Last chance,
Okay.
guys.
Most are going
Okay.
with the
Most are
A.
going with the A.
Most are going with the
Most are
A.
going
And
with the
final
A.
answer
And
will
final
also go
answer
with
will
the
also go with
yes.
the yes.
Methotrexate
Methotrexate
inducible
because
ALT raised,
ALT
AST
raised,
raised, and
AST
also
raised, and also
GGT, which is
GGT,
raised
which is raised
at the same time.
at the same time.
Okay. And
Okay.
the person is
And the
given
person is
some
given some
drug. So
drug.
drug
So
induced
drug
hepatitis.
induced hepatitis.
GGT things are
GGT
there.
things are there.
This is the thing.
This is the thing.
Okay. So this is
Okay. So
another
this is
little different
another little
variation of
different
things.
variation of things.
All right.
All right.
Okay.
Okay.
I think it's a repeat
I think
question.
it's a
Sorry
repeat
for
question.
bringing
Sorry
this
for
one.
bringing
But the
this one.
following is
But
not
the following
considered
is not
extractable
considered
ability
extractable
gestation. That's
ability
I think
gestation.
is
That's
the
I think
heavy
is the
bringing. Sorry
heavy
for
bringing.
bringing
Sorry
that.
for bringing that.
Okay.
Next one is the patient taking methotrexate, prednisolone, celecoxib for rheumatoid arthritis. Now, lap showing pancytopenia. Please remember, rheumatoid arthritis patients can also develop pancytopenia. Many other conditions like SLE can also develop pancytopenia. So, pancytopenia is like a many conditions cause actually. It's like a sign, actually, pancytopenia. That means your bone marrow is compressed by anemia actually as well, right? Now let's come back to this one. Even though it's been mentioned, it's rheumatoid arthritis and drug names are given and pancytopenia. So which one of the following should be used in the management now? Also, if you look into that one, the drug particular things, and yes.
I think
most of your answers you can see is folic acid and 6 celecoxib.
Alright.
Final answer for this one is a D. Now, last week we tell about a bamboo.
Very
good for health.
Right?
Right? Bamboo looks like this kind of.
The bamboo is
the bamboo is quite bamboo. In our country, it's called bash. Very popular.
Like that. That's
the bamboo. Now, bamboo, how come it can be bamboo? Now, coming to this one, patient taking methotrexate. Patient after taking methotrexate, development of pancytopenia. Now, is this condition leading to, can we say this is a bit overdose of methotrexate? Can you say like that? If you keep giving methotrexate and you do have a pancytopenia, that means your bone marrow is certainly got affected. Now, we call it methotrexate toxicity. If anyone wants mechanism, more details given here. But here's the information. For methotrexate overdose, methotrexate toxicity, folinic acid, also known as leucovorin, used as a rescue treatment.
So it reduces
the methotrexate toxicity. Effectiveness. So is it clear now, guys? So this may be a little new for some people, but methotrexate toxicity, we can use folinic acid or leucovorin.
I'm showing the
question again actually.
Because pancytopenia
means the bone marrow has been already
because of the methotrexate
overactivity.
The treatment is a
rescue treatment needed. Folinic acid. If you don't know this one, it's okay.
Now you know.
Make sure you don't make mistakes in future.
Clear everyone?
So methotrexate toxicity can be
relieved by
folinic acid.
I ask you another
tough question.
Are you guys ready? Let me ask you a
similar sort of tough question.
Now,
there are some drugs in DMA, disease modifying anti-inflammatory drugs.
There's a drug
that can lead to hemorrhagic
cystitis. Hemorrhagic
cystitis is one of the
DMA.
Anyone while reading that one from any charts,
does anyone
find this thing?
Okay, so
answer is a cyclophosphamide.
But this is not the question
actually, unfortunately.
This I'm going to start.
So if you think this is the difficulty level, I'm going for that one.
So hemorrhagic
cystitis is caused by cyclophosphamide.
The question is
which can be prevented by.
Interesting, because why I
asked that one? Because we also have something
like this one. Prevented by
folinic acid. In methotrexate toxicity, prevented by filling the gap dash.
Yeah, that's a tough one.
I hope no one is. Well done. Someone else came up.
Yes,
Mesna.
Okay, so it's a
Mesna.
Okay, not important for
MC by the way, but if anyone goes for USMLE, it is usually a very popular question.
So hemorrhagic
cystitis caused by this. It's prevented by Mesna, and here methotrexate toxicity prevented by folinic acid. I'm doing a little compare and contrast.
It's because of the different
remember things. Yes, of course, lot of fluid is important.
Going for the next one.
Middle age diabetic and the periarticular osteoporosis. Periarticular osteoporosis is a radiological
findings if
you remember. The narrowing of the ankle joint is a proper diagnosis.
I hope you remember.
I think we don't get much time. Did you remember, guys? Can you imagine the X-rays now in your eyes?
Yeah.
So see,
this is how it
probably
will be tested in
will
your
be
exam.
tested
So
in your exam. So
whenever you think about
whenever you think
rheumatoid
about
arthritis,
rheumatoid
the
arthritis,
other two
the other
comparisons
two
should come
comparisons
there,
should
right?
come
The
there,
another
right?
one is
The
a
another
loss,
one is a
which
loss,
is the
which is the
osteoarthritis, and
osteoarthritis,
another one
and
was
another
given that
one
the
was given
gout,
that the
right?
gout, right?
Now,
Now,
gout does
gout
not have any
does not have
joint
any
space
joint
narrowing, right?
space narrowing, right?
Gout does not have
Gout
any
does not have any
joint space
joint
narrowing, which
space
is a
narrowing, which
normal
is a
joint space,
normal
but
joint
there was
space, but there was
erosion in gout
erosion
actually.
in
So this
gout
one is
actually. So
surely,
this one is
yeah.
surely,
So here is
yeah.
that
So
X-ray.
here
If
is
you
that
remember,
X-ray. If
let
you
me
remember,
zoom that
let me
part.
zoom that part.
So that one more
So that
time
one more
revision.
time
So
revision. So
LOSS. So there is
LOSS.
a
So there is
cyst.
a cyst.
There is a loss of
There
joint
is a
space
loss of joint space
osteoarthritis,
osteoarthritis,
periarticular,
periarticular,
juxtaarticular osteopenia,
juxtaarticular
and loss of
osteopenia,
joint
and loss
space
of
in case
joint
of
space in case of
this rheumatoid
this
arthritis, and
rheumatoid
no
arthritis,
joint
and no
space
joint
lost
space
in
lost
gouty
in
cases
gouty
actually, but there
cases
can be
actually,
some
but there can be
erosion.
some erosion.
I hope that's
I
clear
hope
to
that's clear
dear
to
doctors.
dear doctors.
Okay.
Okay.
Moving forward.
Moving
The
forward.
next question.
The next
That's
question.
a quite a
That's a quite a turn.
34-year Rohini
34
presents
year
with a
Rohini
pain in the
presents with a
both
pain in
hands
the both
for last
hands
few
for
months, and
last
his
few
stiffness
months, and
improves as the
stiffness
days
improve
go
as the
away. We
days
do
go
have a
away.
hint
We do
here.
have a hint here.
Multiple joints are
Multiple
swollen in
joints are
each of the
swollen in
hand,
each of the
showing
hand,
some
showing some
erosion, X-ray
erosion,
showing. Okay.
X-ray showing.
Which
Okay.
is the
Which
accurate
is the
test for this
accurate
one.
test for
Okay.
this one. Okay.
Please check out the last
Please
line
check
when
out the
they're
last
asking
line when
about
they're asking
accurate
about
test. Most
accurate
maybe
test.
some
Most
very
maybe some very
spatial disease. When they
spatial
ask about
disease. When they
accurate
ask
test,
about
maybe
accurate
some
test, maybe
spatial
some
disease. Now,
spatial disease.
this
Now,
one indicating
this one
pain in the both
indicating
hands
pain in
with
the both
multiple
hands
joint
with multiple
involvement.
joint
Improves
involvement.
the
Improves
rest of the
the
day.
rest
That
of the
means
day. That
it's
means
high
it's
chances of
high
rheumatoid
chances of
arthritis, and if
rheumatoid
it's a
arthritis, and
rheumatoid
if it's a
arthritis,
rheumatoid arthritis,
anti-CCP
anti-CCP
antibody.
antibody.
Rheumatoid arthritis
Rheumatoid
improves by
arthritis
the day
improves by the
progresses. The
day
person
progresses.
in
The
most cases
persons
a
in
bit
most cases a
young,
bit young,
and
and multiple
multiple joint involvement, including the hand
involvement, including the
joints,
hand joints,
stiffness,
stiffness,
deformities. These
these
things
things
can
can
be
be
there.
there.
Alright, so
Alright, so
anti-CCP antibody.
anti-CCP
Have
antibody.
you seen the
Have you seen
SMA
the SMA
note on the
note on
rheumatoid
the
arthritis
rheumatoid
curves?
arthritis curves?
SMA note on
SMA
the
note
RA?
on the RA?
Alright, I hope you've
Alright,
seen
I
that
hope
one.
you've seen that one.
Great.
Great.
Okay, here is
a
little
little
mnemonic for you.
mnemonic for you.
Disease-modifying
Disease-modifying
anti-rheumatic drugs
anti-rheumatic
safe in
drugs safe in
pregnancy
pregnancy
as like a cash.
as
Now, how
like a
many of
cash.
you
Now, how
like
many of
this?
you like this?
Very weird
Very
question.
weird question.
Now, how many of you
How many of
probably
you probably
like
like
a bundle of
a bundle of
dollars actually?
dollars actually?
It can be anything.
It can
It
be
can be
anything.
exam
It
fees.
can
It
be
can
exam
be
fees. It can be
shopping. It can
shopping.
be
It can be
so no one
so no
will
one
mind
will mind
like a
like
bundle
a
of
bundle
dollars
of
like this.
dollars like
Okay, anyway,
this.
so
Okay, anyway,
the
so
mnemonic
the
cash is
mnemonic
quite
cash is
appropriate
quite
actually.
appropriate
Now
actually.
this type
Now
of
this type of bundle
pictures, if you
pictures,
really
if you
love it,
really love it,
you should put
you should
bundles
put
like that
bundles like
in
that
your screen,
in your
because when you
screen,
become
because when you
an
become
MC doc,
an
now
MC doc. Now,
let me ask you,
let me ask
did
you,
you know,
did you know, I mean,
say example,
say example,
if you pass
if you
MC, if you
pass
become
MC, if you
doctor and you
become
get your
doctor and you get
registration
your
after one
registration
year,
after 1 year,
which we call the
which we call
GCO,
the
I mean
GCO,
general
I mean
registration
general
often.
registration
After
often.
working in
After
Australia
working
for
in
1 year,
Australia
you
for
get your
1 year,
general
you get your
registration.
general
Then
registration.
you are all set
Then
to
you are
do the
all set to
locum.
do the locum.
Everyone understand the
If you
word
don't
locum?
understand the word
Means you
locum,
can
means you can
offer outside
offer
of your
outside
hospital
of your
actually.
hospital actually.
In our local,
In our
I mean, we
local,
call
I mean,
CAP.
we call
In my
cap.
Bengali,
In
I
back
mean, in your
Bengali, I
country,
mean,
maybe
in
you
your
say
country, maybe
something.
you say
I
something.
mean,
I
many
mean,
doctors,
many
while
doctors, while
working in your own
working in
hospital,
your
they
own
will
hospital,
also
they
go
will
outside
also
the
go
hospital
outside the
for
hospital
little
for
extra earning
little
actually.
extra
Now,
earning
the
actually.
question
Now,
is how
the
much
question is how
does
much
a Australian
does a
doctor
Australian
earn
doctor earn
for one
for
day if they
one
go
day
for
if they
locum?
go for
Locum
locum?
say
Locum say
from
from
7 to 7.
7
This
to
is how
7.
maybe
This is
many
how
time.
maybe many
So
times.
7 to
So
7,
7 to 7,
locum, because when you are going
because
for a
when you are
locum,
going for a
you will go
locum,
for a
you will
little
go
bit
for a little bit
larger shift.
larger shift.
All right.
All right.
Yes. Well done.
Yes.
So it's
Well done. So
nearly
it's nearly
like this.
like this.
Okay. So
Okay. So
1,200 to
1,202.
yes.
Yes.
So that's the thing.
So that's the thing.
Right.
Right.
It's for
It's
1 day.
for
So
one
if
day.
you
So
do
if you do
locum,
two locum,
probably you can fly
probably
to
you
some
can
different
fly to some
country
different country
very easily.
very easily.
Right.
Right.
So in your two
So in your
locum, you
two
can
locum, you can
give a ride to a
give a
different
ride to a
country.
different
Actually,
country.
$6,000 is quite
Dollar
pretty
is
enough to
quite pretty
travel.
enough to
Do you
travel.
agree, guys?
Do you agree,
Those
guys?
of you are into
Those
travel,
of you
you
are
know.
into travel, you know.
Yeah.
Yeah,
I think
I
six
think
thousand
six
dollar
thousand
I think.
dollar
So
I
just
think.
with
So
two
just with two
yeah,
Yeah, you can fly easily actually. Yeah, so that's important. And those of you who have experiences like 2 to 3 year or even more, you can even apply even after MC part one. A lot of doctor ask me. I mean, I do have a session on that one to guide you guys. So after MC part one, that you can apply for the job under limited registration actually. Limited registration. So you pass the MC part one, then you finish the English test, and you can apply for the job. The job you get the registration. This registration will be limited registration. Okay. So after that you join. You get your visa. And in terms when you get the visa, if you have someone like your spouse, you can also apply for them at the same time. Okay. So this visa includes spouse included actually. Doesn't mean I'm encouraging you to get married soon. I mean, if you are single, it's even more better to fly alone actually. Okay. These are tips. Yes. So here is the thing. So if you are not married yet, I do have a teacher actually. So he was about to get married, and I was telling him, your success is almost coming and knocking at the door. Okay, so why you are messing it up? I mean, so no, my mom is telling, maybe one June class maybe you attended. He just recently passed the best actually. So actually, the thing I was telling you that don't moms are always come up with this idea, right? So moms will be moms, so it's okay actually. Marriage actually, see, marriage in Australia is a vice versa. Anyways, if anyone is joining in Australia, sooner or later he will get the PR or citizenship. So, I mean, unless if you don't have another choice other than the ANC, then it can be. My first question, why to get married to Australian or anyone? I mean, it was not much elderly to get married and now very quickly. Anyways, that's different people and different opinion. It's just how we are making jokes actually. It's just making jokes like, because you're just going now. Because I believe it's a responsibility. I believe it's a big responsibility. Actually. Because see, we as a medical people, thinking that way, we as a medical people, from the beginning of our life, we are burning. We see few things behind the track. It is written like burning since birth. I mean, in Bengali, জন্ম থেকে চলছি, you guys can understand the Bengali that it was burning since birth. So we are kind of like that. From school it started, coaching this, that, then this A levels, then this O levels. Okay, then again into this even medical field and post graduation maybe for some or maybe the MC. So did you guys ever have any break? So if I ask you guys, so did you guys ever had any break? I mean, not really, honestly, from the studies. Not really. I mean, unless after MBBS you had a break, that's a different. But otherwise, probably you never had any break. Yeah, some people also think, okay, internship was probably like a break. It was not studying that much actually. Right. So that's the thing. So that's the thing. So I'm taking like, break from studies a little bit. If you finish the MC1 and MC2, you actually can take some break for like 1 to 2 years. Then you can go for some fellowship in Australia, which we will talk about some other day. Now, let's focus on that one. I mean, in a subtle way, I'll be putting things in your mind. Don't worry. Now, this is some of the drug. Okay. This is safe. These drugs are safe in pregnancy. Okay. These drugs are safe for pregnancy. Cisplatin, sulfasalazine, hydroxy, chloroquine. Again, sulfasalazine in male, it may not be. Yeah. Good. Okay. Anyway, you can make the mnemonic. I don't mind as long as you remember. Moving forward, I hope in between classes those informations are given. It stayed in the mind better. What do you think, guys? I mean, few things if we put in subtle way, rather than, for example, if I start talking for 1 hour for the Australian, which I will talk, don't worry. But subtle way, if I put few things, it creates curiosity actually. All right. Good luck, guys. Cash is better. Yes.
Of course, cash is
Of
better,
course, cash is better,
than
than
no other money
no
can
other
beat that
money
one,
can
right?
beat that one,
This
right?
can motivate
This
you
can
actually.
motivate
You
you
can put
actually. You
some
can put
cash,
some
euro,
cash,
dollar,
euro,
Australian
dollar,
dollars in your
Australian
screen
dollars in your
actually.
screen
Okay,
actually.
you can put
You can put a.
I asked this
I
question to
asked
one
this
of the
question to
doctor,
one of the
a
doctor,
few doctors in
a
other
few
batch.
doctors in
If you
other
want to
batch.
put a
If you
picture,
want to
that
put a
might
picture,
tempted
that
you
might
what it
tempt
could
you
be
what it
actually.
could be actually.
So different type
So
of
different type of
answers were coming
answers were
actually.
coming
So
actually.
if you
So
said, okay,
if
I
you
want to
said,
put
okay, I
a
want to put
Mercedes,
a
I want to put
Mercedes, I want to
BMW,
put
Ferrari,
BMW, Ferrari,
this, that.
this, that.
Yeah. So what it
Yeah.
would be
So what
actually,
it
this
would be
in one
actually,
word
this in
before going
one
to the
word before
next
going
one.
to the next
So
one.
what do you like?
So
Some
what do you
people
like? Some
can
people
put cash
can put
picture,
cash picture,
briefcase of
briefcase
dollar.
of dollar.
Some people can put
Some people
travel.
can put
Yeah.
travel. Yeah.
So if you want to
So
put
if you
one
want to
picture
put
that
one picture
motivates
that
you,
motivates you,
what it be?
what it be?
Yes. Yeah, money.
Yes.
It's
Yeah,
fine
money.
actually.
It's
No
fine
harm.
actually. No harm.
For ladies,
For
maybe
ladies, maybe
shopping, Gucci,
shopping, Gucci,
Louis Vuitton,
Louis Vuitton,
yeah, anything.
yeah, anything.
Yeah.
Yeah.
For
For
some
some
boys, I think you can
boys, I think you
put
can
your dream
put
girl's
your
picture
dream girl's picture
in the screen.
in the screen.
Yeah,
Yeah,
it's okay.
it's okay.
Okay. So we can
Okay,
have a
so we
whole
can have a
different
whole
discussion on
different
that one.
discussion
Some
on
other
that
day,
one.
just
Some
focus
other
on
day,
the
just
studies
focus on
today.
the
Yes.
studies today.
All
Yes.
right. You can
All
also
right.
put,
You can also
whatever
put,
might,
whatever might,
your dream
your
and one
dream
picture
and
that
one
my name
picture
is
that
still
my
see. It's
name is
a
to see. It's
simple
a
question, but
simple question, but
it makes you
it
think a
makes
lot.
you think a
Okay.
lot.
Coming to the next
Coming
question,
to the
we'll go
next
for
question, we'll go
next
for
eight
next
questions very
eight
quickly.
questions very quickly.
75-year
75
female
year
have
female
a
have
number of
a
drugs
number of
including
drugs
statin
including
and
statin,
proximal muscle
and
weakness
proximal muscle
means
weakness
this
means
movement is
this
affected,
movement is
or
affected, or
this movement is
this
affected.
movement is affected.
On examination,
On
muscles on the
examination,
shoulder
muscles on the
tender,
shoulder tender,
laboratory shows
laboratory
raise
shows raise
ESR in the
ESR
CK.
in the CK.
So this lab
So
finding
this
is
lab
very
finding
important.
is very important. I
I
remember
already
I
explained
already
this lab
explained
part. You
this
don't have to
lab
even
part. You
see
don't
the
have to even
question when
see
you
the
see this
question when
lab.
you see this
See?
lab. See?
So what do you think?
So
What
what do
is
you
the
think?
right
What is
answer
the
for
right
this one? I
answer for
think
this one? I
most
think
people put the
most
answer
people put the
D,
answer
and you guys
D,
are
and you guys
absolutely
are
getting
absolutely
talented
getting
batch looks
talented
like.
batch looks like.
Yes. Now,
Yes. Now,
why this is
why
D?
this
I
is
think
D?
if you
I
because
think
of
if you
this
because
actually.
of this
In
actually.
our
In
lab,
our
it was
lab, it
mentioned
was mentioned
ESR raised and
ESR
CK was
raised and
normal.
CK
Let's
was
go back
normal. Let's go
and
back
see it again.
and see it again.
Some of you came
Some
with
of you
a
came
A. It
with
was
a A.
wrong.
It was wrong.
Raised ESR
Raised
and the
ESR
CK
and the
normal.
CK
Now, if
normal.
it would have
Now, if
been
it would have
A,
been A,
all supposed
all
to be normal,
supposed to be
isn't it?
normal, isn't it?
So for A,
So
all
for A,
supposed to be
all
normal.
supposed to be normal.
I hope that's
I
clear
hope
to
that's
all
clear
the
to
doctors. I
all
hope
the
that's clear
doctors. I hope
to
that's clear to
all the
all
doctors.
the doctors.
Perfect.
Perfect.
Now we do have
Now we do have another.
Please check this
Please check
question
this question
and please
and
tell me the
please tell
answer.
me the answer.
The
I,
question is
the
big,
question is
but many
big, but
times some of
many
the
times some of the
questions,
questions,
if you know where
if
to
you know
look
where
at,
to look at,
you actually don't
you
need
actually
much
don't
time.
need
This is
much
how you can
time. This is how you
save
can
time.
save
A
time.
lot of people
A
have
lot
the
of
habit
people
of
have the
reading the
habit of
whole
reading the
question
whole
again and
question
again,
again and
and
again,
then it all
and
takes
then it
more
all
time. So
takes
if you
more
get
time. So if you
idea,
get
this is about
idea, this is
proximal
about proximal
myopathy.
myopathy.
If it's a question about
If it's a
proximal
question about
myopathy,
proximal
just
myopathy,
quickly look
just
in the
quickly look in
down
the
always in
down,
proximal
always in
myopathy question.
proximal
If there is
myopathy
any
question. If
lab
there is any
given,
lab
if
given,
there is any
if
lab
there is
given,
any
that
lab
means
given, that means
ESR and CK is
ESR and
supposed to be
CK is
given. And
supposed
if
to
you
be given.
find
And
that
if you
you guys are
find that
CK
you
need
guys are seeker need
ESA and the CK
ESR and the
finding,
CK
you don't
finding,
need
you
to
don't need
see
to
the many
see
other
the
things
many
because that
other things
is
because that
your
is
area
your
you need
area
to see.
you
So
need to
for
see.
this
So for
question,
this
we found
question, we
ESR and the
found ESR
CK
and the
all
CK
are within
all
normal
are within
limit.
normal
If
limit.
all are in
If
normal
all are in
limits,
normal limits,
100% sure your
100%
answer is
sure
a
your answer is a
drug-induced
drug-induced
myositis, right? So
myositis,
when you
right?
see the
So when you
question
see the
first line
question
or the
first
second
line or the
line,
second
and you
line
find
and you
proximal
find
muscle
proximal muscle
myopathy,
myopathy,
weakness is given,
weakness
that
is given,
means
that
it's
means
a high
it's a
chances.
high chances.
About proximal
About
muscle
proximal
myopathy.
muscle myopathy
Question: three
question, three
conditions based
condition
on one
based
lab.
on one
So that
lab.
lab we
So
need
that
to look
lab we need
forward
to look
actually. And here
forward
it's
actually. And
given
here
everything
it's given
normal.
everything normal.
Definitely it's a
Definitely it's a
drug-induced
drug induced
myopathy. Is it clear to
myopathy. Is
everyone?
it clear to
Last
everyone?
two
Last two
questions, 14
questions,
and 15,
14
is
and
these two
15, is
questions are
these two
clear. This
questions are
one
clear.
and
This one and
another one, this one
another one,
actually.
this one actually.
So this one I
So this
want
one
this
I
kind of
want this
questions
kind
are
of
dream
questions are
questions.
dream
You
questions.
definitely can
You
answer this
definitely
kind
can
of
answer
question
this
in the
kind of
main
question
exam
in the main
from the
exam
perimeter.
from
So
the
I want
perimeter. So I
all of
want
you to
all of
answer
you to answer all type of question from rheumatology, not missing any single question from the rheumatology particularly. Okay, 37 years because it's quite possible to answer from rheumatology. That's why a proper preparation is important. 37 year comes with a multiple joint. Yeah, coming with a multiple joint things. Yeah, so that. Yeah. 37 female comes with a multiple joint pain, and there's dryness and some lab findings as well. I think it's not difficult if you look into the lab. Someone mentioned something about the last question. There's a headache that's make you confused. Please understand one important information that clinical versus lab. You need to focus first actually. So that's all. Now, coming to this one is everything about the dryness. So it's about the Jogrens. It talks about the Jogrens. What is right here? So higher chances. So this is the next step of management. D, that is artificial vector, initial step of management. Artificial steer thing. Okay, then we'll think about drugs and this that if it's necessary. Try conservative treatment initially. Try conservative treatment initially. A differentials can be reactive arthritis or writers, but there will be history of exposure, can't see, can't be, can't climatically. Distinct syndrome, that's a differential. And our diagnosis is a Jogrens, which is related to all the dryness with anti-La and anti-Lo. By the way, anti-La and anti-Lo is also same thing, or we call it synonym, like a anti-SSA and anti-SSB. Did you know this information? That anti-La and anti-Lo can be also addressed as anti-SSA and anti-SSB. It was given in the same chart. So those of you looked into the chart carefully, you saw both synonyms. Some of you only remember the anti-SSA and anti-SSB. So La and Ro. Great. So few things are related to Jogrens syndrome, which is chronic, and it's everything about the dryness, including dyspareunia, like pain during sexual intercourse. Because of dryness, there can be dental caries as well. So you do simple blood test, later salivary gland biopsy. This one you can read separately, so more accurate test, even though we don't do it much often. Mostly clinically we make the diagnosis very easily. So it's accurate is a salivary gland biopsy. Anyways, moving forward. This one is nice. So about Jogrens syndrome. Okay. So the initial diagnosis is an autoantibody test, whereas the confirmatory by a biopsy. Autoantibody test is anti-La, anti-Lo, this particular thing. A confirmatory means biopsy, salivary gland biopsy. I hope that's clear. Moving to the next one. I'll be telling you a few things about osteoporosis. Osteoporosis is a overlapping topic for us actually. It's an overlapping topic for rheumato, endo, then little bit about like the gynae ops as well actually. Okay. Before getting into that one, let me move superficially for this particular one. Like before, because there will be, I mean, 4-5 questions from the osteoporosis. So can we go and explain the osteoporosis a little before we start? Is it okay? Okay. Don't worry. First of all, osteoporosis things will come in the main exam. We'll be given a brief detailing. Be given. Don't worry. So let me first of all bring something for you. So there's certain slides that can be really helpful. One of them is this. Okay, so this is a summary slide that's useful for all of you. And one more I would like to put this one, and one I like to
Take this one.
Take this one.
About the
About
osteoporosis,
the osteoporosis, maybe
this one here.
this one here.
Maybe this
Maybe
one.
this one.
Yeah.
Yeah.
Just to give you idea
To give you
what's
idea
going on
what's
here
going
actually.
on here actually.
Correct.
Like,
Correct. We are ready.
all right, we are ready.
Now
Now,
osteoporosis,
osteoporosis,
is a condition.
is a
Is it a
condition.
common
Is it a
condition?
common condition?
A very common
A very
question.
common question.
Commonly asked, like,
Commonly
is it
asked, like,
common?
is it
Yes.
common? Yes.
Postmenopausal,
Postmenopausal,
pausal,
pausal,
positive family
positive
history,
family history, and
using steroid, early surgery,
like
early surgery,
early
which will
surgery,
lead you to
which will lead you to
menopause. Actually, these are
menopause.
some of
Actually,
the
these are some
very
of the
common
very
thing.
common
Some
things.
other risk
Some
factors:
other risk
sedentary
factors:
lifestyle,
sedentary
smoking.
lifestyle,
A
smoking.
quick question:
A quick question:
doctors develop
doctors develop
osteoporosis more
osteoporosis
early.
more early?
True or false?
True or
True.
false? True.
Why?
Why?
Sedentary lifestyle,
Sedentary lifestyle,
smoker,
smoker,
doctors are often
doctors are
smoker,
often
many
smoker, many
doctors.
doctors.
Maybe in our country it
Maybe
is
in our
less,
country it
but
is less, but
certainly in Western
certainly
world,
in Western
even
world,
lot of female
even
doctor
lot
they
of female
smoke a
doctor
lot
they
actually
smoke a
use
lot actually
to
use
relieve
to
stress and
relieve
all this thing.
stress and all this thing.
In medical field,
In
is it
medical
more
field,
male
is
or
it more
female?
male or
Again,
female?
like
Again,
more female,
more female
usually
usually
than male,
than
of
male,
course.
of course.
All right.
All right.
So in general, if
So
you
in
see, I
general,
mean,
if you
my
see,
question
I mean,
was
my
is
question was is
doctors are more prone
doctors are
to
more
develop
prone to develop
osteoporosis.
osteoporosis.
Definitely, it's a
Definitely,
yes
it's a
actually.
yes actually.
Okay, and
Okay,
female does
and
have
female does have
calcium and
calcium and
vitamin D
vitamin D
deficiency.
deficiency.
What do you think?
What do you think?
Especially in our
Especially
Asian
in our
zone, it's
Asian
even
zone,
more.
it's even more.
And if in by
And
any
if
chance
in by
anyone has
any
a
chance
family
anyone has a
history, then
family
you should
history, then you
really
should
important. You
really
should look
important.
after
You should look
yourself
after
and
yourself
also your
and also your
relatives. Actually, if
relatives.
any by
Actually, if
any chance any
by any chance
positive
any positive
history of
history
osteoporosis
of
in the
osteoporosis
family
in the family
from the age of
from the age
40,
of 40,
probably you have to be
probably you
careful.
have to be careful.
That includes
That
what? That
includes
includes
what? That
few
includes
changes in
few
the bone,
changes in the bone,
which happens with
which
time,
happens with time,
which you can
which you can
try halt those
try halt
preparation.
those
Actually, now
preparation. Actually, now
I'm
I'm
drawing a bone and I'm
drawing a
drawing
bone
try
and
to
I'm
drawing
drawing
a
try to drawing a
blood vessel.
blood vessel.
Okay. So
Okay.
this one is
So
a
this one is
blood
a
vessel.
blood
Now
vessel.
normally in
Now
our body
normally
what
in our
happens?
body
There's two
what happens? There's
processes.
two
One is a
processes. One is a
osteoblastic process
osteoblastic
and one
process
we call
and
the
one we call the
osteoclast.
osteoclast.
Okay. So
Okay.
blast is
So
this way
blast is
and one
this
is
way
a
and one is a
osteoplastic.
osteoplastic.
Osteoplastic process
Osteoplastic
means with the
process
time
means with the time
progresses,
progresses,
ages and this
ages
that.
and this that.
From the bone
From the
there are
bone there
calcium.
are
So
calcium. So
with the
with the
osteoclastic process, the
osteoplastic process, the
calcium from the
calcium
bone
from
comes
the
to the
bone
blood,
comes to the blood,
for
for
regulation,
regulation,
for regulation
for
of
regulation of
parathormone, hormone, and
parathormone,
this that.
hormone,
So
and this that.
the
So the
osteoplastic
osteoplastic
process and
process
osteoblastic
and
process
osteoblastic
both are
process
keep
both
going.
are keep going.
Right. Now,
Right.
as the
As
time
the time
progresses and
progresses and
as people
as
started
people
to
started to
getting aged,
getting aged,
the osteoplastic
the
process,
osteoplastic process,
are overtaken
are
the
overtaken the
osteoblastic process.
osteoblastic
Now,
process.
is
Now,
that a
is
good
that
news or
a
a
good
bad
news
news?
or a bad
If your
news? If your
osteoplastic is more than
osteoplastic is more
osteoblastic,
than
that means
osteoblastic, that
you are
means
having
you are having
less bone
less bone
formation, you are
formation,
having
you are having
more bone
more
destruction.
bone
So,
destruction.
osteoblastic
So
is a bone
osteoblastic is a
destructing
bone
process.
destructing process.
Okay.
Okay.
So this we
So
don't want this
this we don't
plastic
want
thing.
this
Now we
plastic
have
thing. Now
some
we have
drugs
some
that can
drugs
hold this
that can
process. The
hold this
plastic
process. The
process.
plastic
So
process.
if you take the
So if you take
calcium
the calcium
plus vitamin
plus
D, which is
vitamin
very
D, which is very
popularly prescribed,
popularly
it
prescribed,
only
it only
stimulate the plastic
stimulate the
process. Now,
plastic process.
if you
Now,
only give
if you
the
only give the stimulate the
process,
plastic process,
do you think
do you
your
think your
certain
certain
changes in your
changes
body
in your body
will
will
still stop the
still
process
stop
if
the
you
process
start getting
if you
more
start
old?
getting more old?
So not really.
So
If
not
you
really.
start getting
If you
old, then
start getting
the
old,
plastic
the
process is still
plastic process
ongoing.
still
Now,
ongoing.
the
Now,
question is
the
there any
question
way
is
to
there any
stop
way to
this
stop this
osteoclastic process?
osteoclastic
The answer
process?
is a
The
yes.
answer
So
is
there
a
is
yes.
a
So there
drug
is
like
a drug like
alendronate.
alendronate.
Also
Alendronate,
called
also called
bisphosphonate.
bisphosphonate.
Okay, so this is the
Okay, so
particular
this is the
drug
particular drug
that actually
that actually
directly affects
directly
or it
affects or it
halts
halts
the
the osteoclastic
plus
process,
it also
plus it
stimulates
also
the
stimulates the
plastic process at the
plastic
same time.
process at
That
the
means
same time. That
rather
means
than your
rather
bone
than your
getting
bone getting
distraction, rather
distraction,
than you
rather
start
than you start
building up your bones
building up your
actually.
bones
Okay,
actually.
so that means
Okay,
if
so
anyone is
that means if
prone to
anyone is
develop
prone to develop osteoporosis
osteoporosis at a certain
at
range,
certain range,
they're in at a
they're
risk
in at a
factor,
risk factor,
at some risk,
at some
you know.
risk, you know.
Now, for this
Now,
one, we
for
do have
this one, we
a
do have a
certain
certain
parameter actually.
parameter
Now
actually.
you can see the
Now you
green
can see the
part.
green part.
Uh, in
Uh,
the green
in
part,
the
like
green
this is
part,
given
like
in
this is
minus
given
one.
in
So bone
-1.
marrow
So bone marrow
from
from
uh,
uh,
like you can see
like
up
you
to
can see
minus
up to
one is
-1
considered
is
normal
considered
bone,
normal bone,
whereas from the
whereas
minus
from the
one,
-1,
whereas from the
whereas from the
minus one up to
-1
minus
up to
2.5, the yellow
-2.5, the
zone,
yellow zone,
low bone
low
mass.
bone
I mean,
mass.
even if
I
you
mean,
check, I
even
think
if
many
you
of
check, I
you,
think many of
especially
you,
the female,
especially the
they might
female,
have
they might have
low bone mass, which
low
is very
bone mass,
common
which
in
is very
Asian
common in
and
Asian
even more common
and
in
even more
doctors
common
and
in
sedentary
doctors and
workers.
sedentary
I'm
workers.
sure none of
I'm
you
sure none
probably
of
are
you
not
probably are not
a sports
a
person. I
sports
mean, if
person. I
anyone,
mean, if
it's
anyone,
good.
it's
But
good.
otherwise, I
But
don't think so.
otherwise,
Is
I don't think so.
anyone
Is
who is
anyone
always
who
go to
is
the
always
gym
go
or
to the
a
gym
sports
or a
person,
sports person,
which can be
which
different,
can
or
be
some
different,
cases
or
it's
some
genetic,
cases
and
it's
even from the
genetic, and
European
even from the
background,
European
you
background.
have the habit
You
of
have the
going to
habit
the
of going to the
uh,
uh,
beach areas
beach
and
areas
having the
and
sun. And
having
there's
the
another
sun. And
problem
there's
for
another
us, like
problem for
because
us, like
we
because
are mostly
we
Asian,
are
if we
mostly
go to
Asian. If
the
we go to the
sun, commonly we
sun,
get tan
commonly we
very
get
fast. So we
tan
don't
very
like
fast.
going
So
to
we
the
don't like
sun
going to the
offenders like
sun
the
offenders like the
Caucasian or European
Caucasian
or
or
those
European or
countries actually.
those
So
countries actually.
this is a
So
problem.
this is
So
a
our
problem.
bone
So
is
our
not
bone
well
is not
developed
well
actually in that way,
developed
and
actually in that
genetically
way,
is
and
also weak.
genetically
So
is
most
also
of
weak.
us
So most of us
suffer these
suffer
processes of
these processes of
osteopenia is so common.
osteopenia is so common.
Osteoporosis actually less
Osteoporosis
people
actually
develop,
less
but
people develop, but
osteopenia, if you do
osteopenia,
the
if
test
you do the
in
test
100 female,
in
I think
100
there's
female, I think
80 you
there's
will find
80 you will find
osteopenia at
osteopenia
some point
at
of
some
after
point of
50.
after
Okay,
50.
this is that
Okay, this is
dangerous
that
now.
dangerous
Now,
now.
low bone
Now,
mass, which
low
is
bone
minus
mass,
1
which
to
is
minus
-1 to
2.5, you
-2.5,
definitely
you
need to do
definitely
what? You
need to do what?
definitely
You
need
definitely
to do the
need
test
to do
first.
the test first.
Now, what is this
Now, what
test
is
is
this
for? You know, you
test is
see
for? You know,
this
you see
level,
this level,
yeah, minus
yeah,
beyond
minus
2.5.
beyond
This is
2.5.
a T
This is a
scoring, and
T
T
scoring, and
scoring
T scoring
process is done by
process is
bone
done by
marrow,
bone
like not
marrow,
bone
like
marrow,
not bone
BMD,
marrow, BMD,
bone mineral
bone
density
mineral
test,
density
DEXA
test,
test.
DEXA test.
Okay, DEXA
Okay,
scan. You
DEXA
must be all
scan. You
heard
must
about
be
this.
all
So
heard
DEXA
about
scan
this. So DEXA
implies
scan implies
this
this
bone mass.
bone mass.
Is
Uh,
it
is
implicating
it
one
implicating
particular
one
area, or is
particular
it
area, or
implicating
is
the
it
whole
implicating
body?
the
Is
whole
it
body?
related to
Is
whole
it
body? It's
related to whole
related to
body? It's
whole
related
body
to whole
actually.
body
Okay,
actually.
like
Okay,
even
like even
density in a
density
different
in a
bone, like
different bone, like
the
the
neck of the femur is
neck of the
the
femur is the
danger area.
danger
So they will
area. So they
also
will
tell you the
also
exact
tell you the
density of
exact
those
density of
particulars.
those
So
particulars.
which are
So
the
which
area
are the area
under
under
danger, they will
danger,
tell you
they
actually.
will
So
tell
it's a
you
very
actually. So
good
it's a
test.
very good test.
Don't
Uh,
hesitate
don't hesitate
to do
to
some
do
test for
some
your
test for your
parents.
parents.
Of course,
Of course,
starting with this
starting with this
calcium and vitamin
calcium and
D
vitamin D
and the
and
DEXA. Doesn't matter,
DEXA.
like
Doesn't
you
matter,
always
like
don't need
you always don't
experts,
need
follows that
experts,
one.
follows
You
that
just
one.
go and
You just
check.
go and
This
check.
is one
This
favor
is
you can
one
do for
favor you
your
can do for your
parents.
parents.
High likely
High
cases you will
likely
find
cases you will
this
find this
calcium and vitamin
calcium
D
and vitamin
deficiency
D
removed, because they
deficiency
will
removed,
be in
because they
between
will be in
minus
between
1 to minus
-1 to
2.5,
-2.5,
and
and
giving them
giving
calcium and the
them
vitamin
calcium and the
D.
vitamin D.
Maybe in the form
Maybe
of
in the
vitamin D,
form
you
of
can also
vitamin D,
give
you can
like
also give like
the ampoule,
the
break the
ampoule,
ampoule
break
and
the
mix it up.
ampoule and
It's
mix it
also
up,
good
and it's
actually.
also good actually.
Okay, so you can
Okay,
save
so you
that
can
one. And
save
in
that
some
one.
cases,
And
if
in
you
some
see
cases, if you see
borderline or quite
borderline or
close, you can
quite
also
close, you can
consider
also
for
consider for
giving this particular
giving
thing.
this particular
In
thing.
my family,
In my
my
family, my
grandmother, we call
grandmother,
Nani,
we
of
call
course.
Nani, of course.
She
She
have this,
she
like
had
still
this,
have,
like
I think
still
she's
have,
still
I think
alive,
she's still
this
alive, this
osteoporosis thing.
osteoporosis
And
thing.
I also can
And
see a
I
little
also can
change
see a
in my
little change
mother.
in my mother.
But anyways, I
But
haven't
anyways, I
gone
haven't
through a
gone
details test
through a
for her
details
yet.
test for her yet.
But for my
But for
grandmother,
my
actually, I
grandmother,
found, and
actually,
it
I
was,
found,
I
and it
mean,
was, I mean,
minus 2.5 actually, and
2.5 actually, and she
is having
is having
osteoporosis diagnosed
osteoporosis
like
diagnosed like
6 years back.
6 years back.
So that time
So
what I
that
did,
time what I
I
did,
think 7
I
years
think
back,
6 7 years
made
back,
the
made
diagnosis.
the
Then
diagnosis.
given
Then given
alendronate for
alendronate
three
for
particular
three
year
particular
in
year
consecutive
in
session,
consecutive
and
session,
very
and
interesting
very
changes I
interesting
found in
changes I
the
found in the
test result
test
actually.
result
Rather than
actually.
the
Rather than
amount of
the amount of
bone issues
bone
were there, I
issues were
found
there, I found
much better.
much better.
Would you believe? That
Would you
means,
believe? That
as I
means,
mentioned
as I
earlier,
mentioned earlier, this
it not
it
only
not
stopped
only
the
stopped the
osteoplastic process,
osteoplastic
but
process,
also
but
stimulated
also
the blastic
stimulated the
process. So,
blastic process. So,
if you're using the
if you're
alendronate,
using the
your
alendronate,
bone
your
is
bone
stay the
is
same,
stay
or
the
your
same,
bone
or
gets
your
better.
bone
What do you
gets
think?
better. What do you think?
If you
If you
use the
use
alendronate
the alendronate
continuously, your
continuously,
bone
your
will
bone
start
will
getting better
start getting
after
better
some time.
after some time.
And
And
miraculously, I found this
miraculously, I
change
found
actually.
this change
So
actually. So
her bone
her
was
bone
real
was
vulnerable
real
and quite good.
vulnerable
So
and
after
quite
three
good.
years,
So
I
after three
stopped
years, I
actually.
stopped actually.
But because
But
keep giving
because
anything
keep giving
continuously
anything
is not good.
continuously is not good.
But now maybe
But
I'm
now
thinking
maybe
about
I'm thinking about
giving that one again
giving that
actually.
one
So
again
the
actually. So
same thing for
the
your
same thing for your
grandparent or
grandparent
parents.
or parents.
You can keep them
You
under
can
the
keep them
radar,
under
and
the
it's not
radar, and
uncommon
it's not
because
uncommon
here if we
because
have
here if we have 100
attending classes,
attending
surely
classes,
in 2, 3, 4
surely in two,
families
three,
there
four
could be
families there could be
osteoporosis, I'm sure.
osteoporosis, I'm
Okay,
sure.
so rule it out
Okay,
those
so
things.
rule it
Very
out those things.
important
Very
life-changing
important life
situation.
changing situation.
Okay, great.
Okay,
Now
great.
coming to
Now
the
coming to the
this particular
this
part, the
particular
scoring
part, the
system I was
scoring
talking
system I
about.
was talking about.
So minus
So
1 to
-1
minus
to minus
2.5.
2.5.
This particular
This
area
particular
related to
area related to
osteopenia,
osteopenia,
and so calcium,
and so
vitamin D.
calcium, vitamin D.
Anything beyond
Anything
minus
beyond minus
2.6 or minus
2.6 or
2.5,
minus
you will
2.5,
go with
you
it.
will go with it.
Alendronate.
Alendronate.
Some drugs are given
Some drugs are
zoledronic
given
acid. Say if
zoledronic
someone
acid. Say if
has
someone has
ulcer problem,
ulcer problem,
then we
then
prefer
we
the
prefer the
zoledronic acid actually.
zoledronic acid actually.
Okay, IV more
Okay,
preferred
IV
than the
more preferred
oral.
than the
Can you tell
oral.
me
Can
why?
you tell me why?
Why IV
Why
is more
IV
preferred
is
than the
more
oral?
preferred than the oral?
Because it can cause
Because it can cause
esophagitis.
esophagitis.
If you
If
use
you use
alendronate,
alendronate,
it goes
and
and
it
it can
goes
cause
and
or
it can
aggravates
cause
the
or
ulcer more.
aggravates
So
the
it can
ulcer
cause
more. So it can cause
esophagitis actually.
esophagitis actually.
So may not
So
be much
may not be
recommended
much
actually if
recommended
the
actually if
persons are
the
already
persons are
elderly and they
already
have some
elderly and they
gas
have some
issues,
gas
certainly.
issues. Certainly.
Okay, now here's
Okay.
some
Now
question.
here's
Let's
some
see how
question.
much you
Let's see how
understand.
much you understand.
If someone
If someone
develops,
develops,
I mean, if you do a
if you do a
bone mineral
bone
density
mineral
test,
density test,
bone mineral density
bone mineral
test, and your
density
finding
test, and
is
your
like this,
finding
what
is
to
like
do,
this,
guys?
what to
Please
do,
answer.
guys? Please answer.
We need an
We
answer.
need an answer.
So what to do
So what
next?
to do
Yeah, we
next?
give the
Yeah, we
calcium and the
give the
vitamin D
calcium and the
because it is
vitamin D because it is
osteopenia. So
osteopenia.
you are
So you
right
are
on the answer.
right on the
You're
answer.
right on the answer.
You're
So
right on the
next
answer.
question.
Next question.
If it is
If
minus
it is minus
2.9,
2.9,
what
you
you
know
want to
what
do
you
in this
want to do
case?
in this case.
So diagnosis
So
definitely is
diagnosis
a
definitely is a
osteoporosis because
osteoporosis
beyond minus
because beyond
2.5,
minus
which is
2.5,
by
which
minus
is by
2.9.
minus
So
2.9.
answer is
So
a
answer is a
alendronate
alendronate
because it is a
because it is a
osteoporosis
osteoporosis
and it is
and it is
alendronate.
alendronate.
Now, same
Now,
question,
same
say
question,
minus
say minus
2.9 and a
2.9
history
and a
of breast
history
cancer
of
10
breast
years ago.
cancer
Now,
10 years ago. Now,
is it very
is
safe
it
to
very
use the
safe to use
alendronate?
the
I mean,
alendronate?
it's
I mean, it's
controversial, but
controversial,
we do have
but
a
we do have a
better drug.
better drug.
So, what is that?
So, what
There
is
is a
that?
drug
There
like
is a
called
drug like called
tamoxifen, or
tamoxifen,
another called
or
is
another called is a
raloxifan.
fan.
These two are
These two are
important. Now,
important.
there was
Now,
another
there was
question
another
in
question
between
in
tamoxi and
between
raloxi.
tamoxi
Like
and
MC
raloxi.
always
Like
ask you
MC
a lot
always
of
ask you a lot
controversial
of
thing.
controversial thing.
IV, you can
IV,
give it in
you can give it in a
single day. It's like
single
a
day. It's
saline, my
like a
dear.
saline,
Actually, you
my
can
dear.
check
Actually, you can
in
check
the Google or
in the Google or
YouTube
YouTube
how it's given
how
actually.
it's
I mean,
given
in the
actually.
single
I mean, in
day,
the
you
single
can
day,
get it
you
actually,
can
my
get
dear.
it
Okay.
actually, my dear.
All right.
Okay.
Now,
All right.
in the
Now,
tamoxifen
in the
raloxifene,
tamoxifen
the next question
raloxifene, the
would
next
be,
question would be,
which one is more
which one is
better
more
in
better
terms of treating the
in
breast
terms of
cancer?
treating the breast
Answer is
cancer?
a
Answer is a
tamoxifen is more
tamoxifen
better.
is more better.
Someday we'll teach you in
Someday
more
we'll teach you
details,
in
but
more
that's okay.
details, but
I'll,
that's okay.
you
I'll
know, give you more
give
guidance.
you more
So
guidance.
on
So
references
on
actually. So
references actually.
tamoxi
So
over
tamoxi
raloxi.
over raloxi.
Okay, in terms
Okay,
of
in terms of
treating
treating
osteoporosis plus
osteoporosis plus
breast cancer.
breast cancer.
Clear, everyone?
Clear, everyone?
Yeah. Yeah. All right. If you have a question,
if you have a question, you
leave it
can leave it
in
in
our
in
inquiry
our
zone. I'll be
inquiry zone.
happy to
I'll
come
be
back to
happy
you
to come
actually.
back to you actually.
Yeah. Yes, some of
Yeah.
them are
Yes, some
better
of
in
them are
case of
better in
vertebral
case of
fracture
vertebral
cases.
fracture
Okay.
cases.
Yeah.
Okay.
As I said,
Yeah.
we
As I
haven't
said,
gone
we
through
haven't gone through
huge detailing thing
huge
because it's a
detailing thing because
huge
it's a huge
chapter
chapter
osteoporosis. Many GP
osteoporosis.
only
Many
work
GP only work
only on the
only on the
osteoporosis. There are also
osteoporosis.
some
There are also some
experts like that actually.
experts
So
like
it's a
that
very
actually.
big
So it's a
field
very
actually,
big
like
field actually,
vertebral,
like vertebral,
non-vertebral fracture. So
non-vertebral fracture.
I'd
I'd recommend you, if you get little time,
osteoporosis
osteoporosis
plus
plus
uh,
check it in a RSCGP. Then you know those vertebral, non-vertebral relevant fracture, and some extra information will be also there. So we are going through the basic understanding now. All right. Now there is kind of complicated question sometimes. If someone presented with a low trauma fracture, low trauma means not related to a car accident, but maybe fall down in a bathroom. Is it an uncommon scenario, guys? Like someone falling down in a bathroom and break the bones. It's not uncommon actually. And why they break bones? We also fell down sometimes. It's because of their bones are weak. It's a lot of weak bones, low mass bones. So if there is osteoporosis or bony changes, more chances of fracture. If someone fall down and fracture happens, it's also indicating that there can be osteoporosis. Normally, if you fall down, you break your bones. Actually. Okay. Now answer to this question, like a low trauma fracture, and what to do in that case. Would you go for after resuscitation, say fracture neck femur case, because of a falling down in a bathroom, you do the resuscitation, you do the surgeries, and now what to do. Now, are you going for a DEXA scan, or are you going for giving alendronate? Because it looks like it's a case of already diagnosed case of osteoporosis. So is it alendronate more preferred because it's a known case, or is it a DEXA scan is still needed? Answer: DEXA scan is still needed. Why? It is because that DEXA scan I mentioned, it shows where are your risk factor, the probability of fractures. Now, is it important if you have a fracture on the right side, your left side can be also in danger? Am I right, guys? Right. So yes, this is very high chance. So if you have a fracture on the right side of the femur, then so how would you know that? You definitely still need the DEXA scan. Is it clear, everyone? So even though some cases few things are clear cut, like example in a GERD case, we don't wait. We directly give 90 ulcer. Every time same formula doesn't work actually. Okay, so we still need to see because it's a complex thing. So because fracture can lead to death. Many, if you see the statistics, many people every year die because of this low trauma fracture. Like, isn't it? You must be heard about many relatives, friends, families. Someone slipped into the bathroom, and then there was a fracture, or maybe died into the bathroom. Have you heard this kind of things? I heard many in my life. So it's not an uncommon thing. So we can prevent this unusual thing. So Australia also deals with this kind of things, like a preventive things, which is preventable. Because if the person is in risk, then the person probably need walking sticks and safety first. And yes, of course, there will be a lot of blood loss. So you need safety first. Then gradually they use the alendronate, heal the bone. Right? But if the patient is in real danger, you need to save the patient. I hope you understand what I'm trying. So this is the area. The person sustained low trauma fracture. So DEXA first as per the RSCGP guidelines. Is it clear? I mean, still more things I'll tell in future about osteoporosis. But we are get to go for the question. It will feel you better. Okay. Old lady, severe osteoporosis. This is the scoring. Your answer, please. Okay, so many people went for zoledronic, and it's because it is osteoporosis plus ulcer. So zoledronic acid. Okay. So without ulcer, alendronate, with ulcer, zoledronic. Good. Okay, sharp turn again. Another relevant question about osteoporosis. As we mentioned, it's an overlapping topic of rheumato, endo, and gynae. Elderly women, osteoporosis, HRT you must be knowing in any postmenopausal woman whoever having symptom going through the HRT normally given for 5 years. Now bone density scoring is done. So what to do next? This one is little tricky. Okay, some people say it's probably E, considering osteopenia, and for final answer, let's get into yes.
Yes. So we'll
Yes.
consider
So
this
we'll
thing as a
consider this
because
thing as a because
scan is done
scan is
minus
done minus
1.7.
1.7.
So we'll prefer
So we'll
calcium,
prefer calcium,
vitamin D.
vitamin D.
Absolutely right answer.
Absolutely
Well
right
done,
answer.
guys.
Well done, guys.
Okay.
Okay.
We discussed this
We
thing
discussed
already.
this thing already.
This
This
osteoporosis thing.
osteoporosis thing.
Yeah. It's a theory
Yeah, it's a
related to
theory related to
rheumato, endo,
rheumato,
and
endo, and
yes.
yes.
Okay. It's not
No,
necessary.
it's not
Okay.
necessary. Okay.
Or
Or
back pain with a
back
history of
pain with a history of
osteoporosis in the
osteoporosis
family.
in the
T
family.
scoring
T scoring
minus
minus
2.5. What to do
2.5.
next?
What to do next?
Osteoporosis anything beyond
Osteoporosis
the
anything beyond the
2.5.
2.5.
Osteopenia is minus
Osteopenia is
1.
minus 1.
Osteopenia is minus
Osteopenia
1
is
to
minus 1
minus
to minus
2.5. And
2.5.
anything
And
beyond
anything
minus
beyond
1, like
minus 1, like
0
0
to
to
minus 1 is
minus
normal.
1 is
Okay,
normal.
coming to
Okay,
this one,
coming to this
T
one.
scoring
T
minus 2
scoring
in this one.
minus
So
2
what
in
to
this
do?
one. So
It's
what to
not
do? It's not
difficult one.
difficult
I
one.
believe
I believe
it's
it's
alendromic actually.
alendromic actually.
Okay, not a
Okay,
difficult.
not a difficult.
Okay. A
A
postmenopausal woman
postmenopausal
on
woman
a
on
HRT
a
since 6
HRT
years
since
now
6
takes
years now
minus
gets
1.2 in the
minus
femur
1.2
as a
in the
vertebra.
femur as a vertebra.
Important information,
Important
calcium and the
information,
vitamin D
calcium
is
and the
normal.
vitamin D
What
is
to do?
normal. What to do?
Okay, similar
Okay,
kind of question.
similar kind of
Normally
question.
we
Normally
suggest
we
to skip.
suggest to skip.
Yeah. So
Yeah. So
because it's been
because
6
it's been
years,
6 years,
we are using the
we are
HRT.
using
The
the
question is,
HRT.
should
The
we
question is,
first
should we
concern
first
comes,
concern
should
comes?
we
Should
go
we
with
go
HRT more
with
than
HRT more than
5 6 years?
five,
Most
six years?
books is
Most
5 years.
books is
Some
5 years.
references
Some
is up to
references is
maximum
up to
6 years.
maximum
It's not
6 years.
7 years.
It's not 7 years.
But most of
But
the books
most
says
of the
5
book
years. So
says
it's
it's 5
already
years. So
6
it's
year. You
already
cannot
six
go
year. You
with
cannot
that
go
one.
with that
Stop
one.
the HRT,
Stop the
and since
HRT,
it's
and since it's
minus
minus
2.1, minus
2.1,
2.1
minus
in is in
2.1
the
is in the
osteopenia range.
osteopenia range.
Osteopenia. Osteopenia
Osteopenia.
means
Osteopenia
minus
means
1 to
minus 1 to
minus
minus
2.5.
2.5.
So this is minus
So this is
1.2.
minus
So can
1.2.
we say it is
So can we say
osteopenia?
it is
Yes. So
osteopenia? Yes.
give
So
calcium,
give
the vitamin
calcium
D.
and the vitamin
Easy
D.
answer.
Easy answer.
It is a
It is a
osteopenia. So this
osteopenia.
zone
So this zone
is
is
osteopenia. This zone is
osteopenia. This zone is
osteoporosis.
osteoporosis.
So it is
So it is
osteoporosis.
osteoporosis.
Okay, someone said why
Okay,
not
someone
B?
said
So
why
if
not
you
B?
only
So
stop
if you only
HRT,
stop
then
HRT,
how
then
do you treat
how do you treat
the
the
osteopenia?
osteopenia?
Osteopenia.
Osteopenia.
This is something in
This is
AMC. You
something
need
in
to be
AMC. You
very
need to be
careful.
very
But
careful.
if
But
this is
if
also
this
correct,
is also
but can we
correct,
say this
but
is
can you say this is
even better?
even better?
This is also
This is
correct,
also correct,
but this one
but
is even
this one
better.
is even better.
I think we have seen
I think we
actually.
have seen actually.
HRT, my dear,
HRT,
it's
my dear,
MBBS
it's an
thing.
MBBS
Why you
thing.
don't know
Why you don't
HRT?
know
HRT is
HRT?
hormone
HRT is
replacement
hormone
therapy.
replacement
How come you
therapy.
don't know
How
about
come you don't know
HRT?
about HRT?
Come on, my dear.
Come on, my dear.
All right.
All right.
60-year-old.
60-year-old.
Yeah, not for all
Yeah,
guys.
not
I
for
mean,
all guys. I
someone
mean,
asking
someone
HRT.
asking
I think we
HRT.
all
I
are
think we
familiar with
all
the
are
word
familiar with
HRT.
the
Okay,
word
maybe
HRT. Okay,
the
maybe
person
the
not familiar with
person
the
not
term
familiar with
HRT,
the term HRT,
but maybe familiar
but
with
maybe
the term
familiar with the term
hormone. Yeah.
hormone. Yeah.
Okay. 60-year
Okay.
whose
60-year
mother was
whose
treated when
mother
was
was treated when
85
was
when
85
fractured
when fractured
and came for
and
a risk
came for a
assessment. Now,
risk
in Australia,
assessment.
they're
Now in
very
Australia, they're
constant. They'll
very
come for
constant.
risk
They will come
assessment.
for risk
It
assessment.
follows the
It
highest
follows the
risk of
highest risk
development
of
of osteoporosis.
development
Very
of osteoporosis.
interesting
Very
question. So
interesting
see,
question. So see,
risk-related questions are
risk-related
also
questions are
component.
also component.
So see
So
these things.
see these things.
A B A
A
B.
B A B.
Higher
Higher
chance early
chance early
menopause.
menopause.
Maybe by
Maybe
surgery,
by
by any
surgery, by
means,
any means,
it will
it will
suddenly stop all
suddenly
your
stop all
estrogen
your
things
estrogen
because
things
maybe you're going
because
for a
maybe you're
surgery
going for a
anymore.
surgery anymore.
Higher chances it will.
Higher
So
chances it will.
winner
So
here is a
winner here is a
this one.
this
Family
one.
history is also
Family history
important,
is
but
also
if you have early
important, but if you have
menopause,
early menopause,
that's the
that's
biggest
the
risk.
biggest risk.
Okay.
Okay.
I'm going faster
I'm going
because
faster
similar
because
type of
similar
question.
type of question.
22, this answer is
22, this
again
answer is again
bisphosphonate
bisphosphonate
here.
here.
But interesting thing
But
is here, there
interesting
is a
thing is here,
history
there
of
is a
breast cancer
history of
and they
breast
didn't
cancer and
offer
they
you
didn't offer you
tamoxi.
tamoxi.
tamoxifen, which is if
tamoxifen, which
we
is
have
if
a
we
separate
have a
answer like a
separate
D
answer like a D
as a
as
tamoxifen,
a
maybe that
tamoxifen,
could be
maybe that
answer.
could
Now
be answer.
we
Now
do have a
we do have
other
a
options like
other options
HRT
like
and
HRT
bisphosphonate.
and
Now which
bisphosphonate.
one is
Now
more
which one
preferred?
is more
Is
preferred?
HRT is
Is
more
HRT
preferred
is
when
more
someone
preferred
having
for
breast
someone
cancer,
having
or
breast
is it
cancer,
the
or is it the
bisphosphonate,
bisphosphonate,
maybe in a form of
maybe in a form of
alendronate or
alendronate or
zolindronate, or anything is
zolindronate or
better? I
anything
mean,
is better? I mean,
tamoxi certainly
tamoxi
best answer.
certainly best
Tamoxi
answer.
not in
Tamoxi
option. We
not
have
in
seen in
option. We have
past
seen in
what you are
past what
expecting,
you
they
are
don't give
expecting.
it.
They don't give
In
it.
that case,
In that
from
case,
the
from
available
the
you have to make a
available you have
choice,
to make
but
a choice,
HRT
but
can't
HRT
be
can't
given because
be
breast
given
cancer.
because breast
Why?
cancer. Why?
HRT is a hormone
HRT is a hormone
replacement therapy that
replacement therapy
also
that
contains
also
estrogen,
contains
and
estrogen,
estrogen
and
can leads
estrogen
to
can leads to
tumor.
tumor.
A lot of
You
tumor
know, a
like
lot of tumor
breast
like
tumor,
breast tumor,
cervical tumor,
cervical
endometrial
tumor,
tumor, all
endometrial
the
tumor, all the
estrogen
estrogen
estrogen dependent
estrogen
tumor. I
dependent
repeat the
tumor. I
word,
repeat the word,
estrogen dependent
estrogen
tumor.
dependent
They
tumor.
can cause it.
They can cause it.
Clear? Great.
Clear? Great.
And yeah,
And
bisphosphonate
yeah,
also good in
bisphosphonate
terms
also
of
good in
treating
terms
the
of treating the
osteoporosis. The
osteoporosis.
patient may have
The
an even
patient may
bigger
have an
risk
even bigger
for
risk for
osteoporosis,
osteoporosis,
which will lead
which will lead
her to death. Do
her
you
to
agree
death.
on that?
Do you agree on
The
that?
severe
The severe
osteoporosis can lead
osteoporosis
someone
can lead
to
someone to
death
death
because very
because
vulnerable
very
bone
vulnerable
and
bone
very high
and
chance
very
it may
high
break
chance it
down
may break down
and the person
and
bleed
the
out.
person bleed
Very
out.
high
Very
chance.
high chance.
Okay, so we should
Okay, so we should
think about treating
think
the
about
severe
treating the severe
osteoporosis first.
osteoporosis first.
Okay, this
Okay,
question, the
this
next one
question,
is
the
a
next one is a
somewhere
somewhere
because
because
needed
needed
receptionist not
receptionist
having a
not
healthy
having a
diet or
healthy diet or
this that, and a
this that and
mother
a
and the family
mother and
history
the family
positive. So
history
it's very
positive, so it's
important
very
to
important
rule out a
to rule out a
bone mineral
bone
density
mineral
test.
density
So
test. So
the question would
the
be
question would be
appropriate next
appropriate
test.
next test.
Okay, so they will
Okay,
ask you
so they will ask you
appropriate
appropriate
test for this
test
person.
for this person. Actually.
Because see, the
Because
mother
see,
has
the
a
mother has
positive
a
family history
positive
of
family history of
osteoporosis.
osteoporosis.
Mother has a family. So
Mother has a
vitamin D
family.
is
So vitamin
example
D is example
for everyone,
for
even we
everyone, even
male
we
and anyone.
male
We
and
should
anyone. We should
go for a test for
go for a
vitamin
test
D.
for
So
vitamin D.
vitamin D is
So
for
vitamin D
universal
is
for
for
everyone.
universal for everyone.
And when someone is
And when
having
someone is having
osteoporosis on the family,
osteoporosis on
is
the
it only
family,
vitamin
is it
D
only
enough?
vitamin D
So we
enough?
need
So
more
we need
in the
more.
case. So the
In that case,
appropriate
so the
mode here when
appropriate
you
mode
have a
here when
family
you have
history
a
of
family history of
osteoporosis.
osteoporosis,
But we do the
but
both
we
tests
do the
together.
both tests together.
Let me clarify
Let
that
me
one.
clarify
We
that
do
one.
all
We
those
do
things
all
together,
those
like
things
vitamin
together, like
D and this,
vitamin
that,
D
and
and
then the
this, that,
bone
and
mineral
then the bone
density
mineral
actually.
density actually.
Okay.
Okay.
Right.
Right.
So appropriate
So
one is a
appropriate one is
bone
a
mineral
bone
density.
mineral density.
Yeah, if family
Yeah,
history
if family history
without
without
family
family
history,
history,
then you
then
go
you
for a
go for a
vitamin D
vitamin D
testing
testing
initially. Yes, of
initially.
course.
Yes, of
Based
course.
on that test,
Based
then
on
you
that
go for
test, then
the
you go for the
further. Normal
further,
that you do, but
normal that
already
you do, but
known,
already known,
family history this stuff.
family history
So you
this
do
stuff.
all this
So you
test
do all
quite
this test quite
simultaneously.
simultaneously.
Okay.
Okay.
So BMD related
So
lot of
BMD related
information
lot
you
of
will find in
information
the
you will find
anesthetic
in the
as well
anesthetic
actually,
as well actually,
related to
related to
fractures, vertebral,
fractures,
non-vertebral
vertebral,
fractures,
non-vertebral
and this thing.
fractures, and this.
Okay.
Okay.
A big thing,
A
have you ever
big
done
thing.
this
Have you
thing
ever done this thing
for your parents or
for your
grandparents?
parents or
Already I
grandparents?
mentioned
Already I
about it.
mentioned about it.
Yeah. So
Yeah.
I mean,
So
if
I
no,
mean, if
you
no,
can
you
do it,
can do
and you
it,
can thank
and you can
me
thank
later
me
in that case
later. In
actually.
that case, actually.
Right. We've done
Have
any
you
test
done
that
any
gives
test
vitamin
that
D
gives
and
vitamin D
calcium.
and calcium?
Often
You
two
know,
things are
often two things are
ignored.
like
One,
ignored.
we
One,
as a
we
person,
as a
we as
person,
a
we as
patient,
a patient,
do you believe we
do you
doctors are
believe we
horse
doctors are horse
patients? Do you agree
patients?
on that
Do you
one?
agree on that one?
Of course.
Of course.
Horse patient ever.
Horse patient ever.
Doctors, they think they
Doctors,
know
they think
everything.
they know
And
everything.
they think, okay,
And
nothing
they
will
think, okay,
happen.
nothing will
I know
happen.
things.
I know
So
things.
doctors are
So
horse
doctors
patient
are
ever.
horse
We
patient ever.
don't
We
care at all.
don't
So it's
care
better
at all. So
you
it's better
go
you
under
go
someone,
under someone,
another doctor
another
actually, who
doctor
will
actually,
guide
who
you
will
and give you,
guide you
and
and give you, and
don't think about
don't
your
think
body
about
that you
your
know
body that
everything
you know
always.
everything
Actually, it's
always.
not like
Actually,
that
it's
how it
not like that how it
operates actually.
operates actually.
So it's
So it's
rather those
rather
people
those
actually,
people
even
actually, when
not a
not even
doctor,
not a
and rather
doctor, and
follow up
rather
better,
follow up better,
has better
has better
progress.
progress.
It's true.
It's true.
Okay,
Okay,
similar question
similar
also will
question
be
also will
skipping
be
actually.
skipping actually.
Yeah.
Yeah.
Alright. Osteoporosis is to breast
Osteoporosis
cancer.
is to
What did
breast
you
cancer.
already
topic already mentioned. It's the tamoxifen. Tamoxifen over the raloxifene. Here is that particular reference. Because we don't find it in a book, so we have to take this one from a references.
So,
So,
Ralux is slightly
Ralux is
less effective
slightly
than
less
tamoxifen.
effective
So,
than
tamoxifen is
tamoxifen.
the
Tamoxifen
winner
is
here,
the winner here,
as you can see.
as you can see.
So, that was that
So that
one
was that
particular
one
question.
particular question.
Tamoxifen over
Tamoxifen
Raloxifene.
over Raloxifene.
Okay, similar
Okay,
sort. Few
similar
of them
sort.
we are
Few of
skipping
them we
now
are
so that we
skipping
can
now
get
so
into
that
the
we can
next
get into
topic
the
actually.
next topic
So,
actually.
next question. So,
Next
just
question.
write
So
some of the
just write
answers.
some of the
23
answers.
answer
23
is
answer is
A.
A.
23 answer is A
23
because
answer
it's
is A because it's
osteoporosis
osteoporosis
developed.
developed.
Then there will be a
Then there
question
will be a
regarding this
question
one
regarding this one
is from our
is from
concept
our
80
concept
years, so
80
very
years, so
elderly,
very
so
elderly,
must be having
so
a
must
weak
be
bone
having a weak bone
and fall from a
and
wheelchair
fall from a
and
wheelchair
some
and
fracture is
some
there.
fracture is there.
So what will be next
So what
step
will
in the
be next step
management
in the
actually?
management actually?
So after
So after
resuscitation done,
resuscitation done,
are you going for a
are you going
alendronate?
for
Are
a
you going for a
alendronate? Are you going for
dexamethasone
a
bone scan? I think
dexamethasone
as
bone
per
scan? I
we
think as per
discussed,
we
we
discussed,
are going for a
we are
bone
going
scan
for a
first
bone
as per
scan
we
first. As
discussed.
per we discussed,
Go for a bone
go
scan
for a
first.
bone
You
scan
already
first.
mentioned.
You already mentioned
Because your
because
other
your
bone
other
can
bone
be
can be
in already
in already
in big risk
in
of
big risk
development of
of
fracture.
development of
So
fracture.
if you
So
start
if you
treating with
start treating
alendronate,
with
it will take a
alendronate,
lot of
it will
time.
take
By
a lot
that
of time.
time,
By that time,
if the other
if the
bone
other
fracture
bone
happened,
fracture
that
happened,
time the patient
that
may
time
not
the patient
survive.
may not
Is it
survive.
clear,
Is it
everyone?
clear,
So
everyone?
this question
So
looks
this
like a
question looks like a
popular and trendy
popular
from
and
the
trendy
osteoporosis.
from the osteoporosis.
We
Osteoporosis,
hope we don't
we
miss
hope
any
we don't
questions.
miss
And
any
one
questions.
question is
And one
always
question is
coming from the
always coming from the
osteoporosis. And
osteoporosis.
this is that
And this
particular
is
chart.
that
You will find
particular
it
chart.
in
You will find
RSC.
it in RSC.
Okay, so
Okay, so
25 again is a
25
very
again is a
similar.
very similar.
So breast
So
cancer
breast
history
cancer
and
history and
tamoxifen not
Tamox
given.
is not
So
given.
this
So
time we
this
are
time
choosing
we are
here
choosing here
raloxifene. So
raloxifene. So
25 answer
25
is
answer
D.
is D.
I'm going a little
I'm going
faster
a
because
little
these
faster
are
because these
similar
are
time.
similar time.
26.
26.
The answer is
The answer is
osteopenia.
osteopenia.
26. The answer is
26. The answer is
osteopenia. Answer is a
osteopenia.
E.
Answer is a E.
Vitamin D and
Vitamin
calcium.
D
So
and
we're
calcium.
skipping this
So
one.
we're
As you
skipping
mentioned, we
this
have
one.
a
As you
60
mentioned, we have
questions
a
to do
60
almost.
questions to
So
do almost. So
female afraid of
female-afraid
osteoporosis
is this,
and as
that,
we said,
and as we
again
said,
a breast cancer
again a breast
history. So
cancer
it's a
history. So it's a
raloxifene. So
raloxifene. So
27
27
answer is
answer
raloxifene
is
C. So
raloxifene C.
26
So
C. You will
26 C.
understand
You
it.
will
So these
understand
are
it.
kind
So
of
these are
repeat.
kind of repeat.
Now
Now,
again a question
again a
related. This
question
one is a
related.
different.
This
So
one
we
is a
will take
different.
this
So we
one.
will take this
Old
one.
lady
Old
in
lady
warfarin,
in
damiprid,
warfarin,
many
damiprid,
multiple drugs
many
with a very
multiple
old
drugs with
age
a very
person with
old
a
age person with a
family history of
family
vertebral
history of
osteoporosis.
vertebral
Patient is having
osteoporosis. Patient is
hematurial.
having
Now very
hematuria. Now,
interesting.
very interesting.
Suddenly a twist
Suddenly, a
and turn.
twist and
Why
turn.
there is
Why there
hematuria in
is
a person?
hematuria in a
Answer:
person?
it can be a
Answer:
drug
it can be a
reaction.
drug reaction.
So it is
So
possible.
it is
Do you
possible.
think that
Do you think
warfarin
that
can lead to
warfarin can lead to
hematuria?
hematuria?
Yes, because
Yes,
we
because
keep
we
checking
keep
INR,
checking
and
INR,
if there is
and
a
if there is a
warfarin
warfarin
level
level
is bit higher,
is bit
that can
higher,
lead
that
to
can lead to
internal bleeding. Actually,
internal bleeding.
warfarin
Actually,
toxicity
warfarin
related, I will
toxicity
tell you
related,
in
I will
much
tell you in
details
much
in
details
pediatrics.
in
Very, very
pediatrics.
important.
Very, very
Very
important.
important. One
Very
question
important.
from
One question from it.
warfarin keep
Warfarin
coming in the
keep
exam.
coming in the
We do
exam.
have a
We do have a
separate session there
separate
actually.
session there actually.
So warfarin
So
toxicity
warfarin toxicity can
cause
really
hematuria
can
into
cause
recent
hematuria to recent
puberty, but I
puberty,
will
but
give
I
you a
will give you a
definitely
definitely
a
a
very clear view of
very
that
clear
one.
view of that one.
Okay, there's
Okay,
another
there's
question.
another question.
I think it's a
I
similar
think it's a similar
129, early
129, early
menopause actually. Which one
menopause
is a
actually.
bigger
Which one is
risk?
a bigger risk?
Early menopause
Early
again actually.
menopause again actually.
Mentioned right?
Mentioned,
Yes,
right?
early
Yes.
menopause.
Early
So this
menopause. So
question
this
29,
question
early
29,
menopause.
early menopause.
Okay.
Okay.
Here is
Here
another
is
question.
another question.
And in this one,
And
the
in
answer
this one, the
is
answer is
alendronate. Why?
alendronate. Why?
Because you will find this
Because you will
question
find this
regarding the
question
minus
regarding the
3, the
minus
level is
3,
given.
the
So
level is
DEXA is
given. So
done.
DEXA is done.
DEXA is done and
DEXA
it's
is done
minus
and
3.
it's minus
So
3.
since it's
So
minus
since
3,
it's
it is
minus 3, it
definitely
is
a
definitely a
osteoporosis. So
osteoporosis. So
it's
it's
alendronate.
alendronate.
30
30
B. 30
B.
D.
30 D.
Again, a risk factor
Again, a
related
risk
question,
factor
early
related question,
menopause.
early
Okay. So they
menopause.
brought
Okay. So
all
they
those
brought all
osteoporosis
those
one.
osteoporosis
So
one.
31,
So
it is
31, it
B.
is
As
B.
I mentioned,
As I mentioned,
similar, so you can
similar, so you
skip.
can
Thus, I'm
skip.
giving you the
Thus, I'm
answers
giving you the
actually.
answers actually.
Mhm. Okay, early
Okay,
menopause.
menopause.
Okay, this one is
Okay, this one
interesting,
is
little bit.
interesting,
A
little bit.
male in
A
his
male
70s.
in
So
his
this time a
70s. So
male
this time a
related
male
question.
related
70
question.
years is
70
an
years
older
is an
person.
asked for osteoporosis. It's just that he's here because his wife diagnosed with osteoporosis recently. Okay, so screening test for him, not her.
So is it
So
important
is it
for
important
him
for
to go
him
for, like,
to
this
go
is
for,
a
like, this is a
answer of someone asked
answer
me
of
this
someone
question,
asked me
doctor,
this
is it
question, doctor,
necessary
is it
that
necessary that
DEXA, always not
DEXA,
always
always
DEXA,
not always
because
DEXA,
if there was a
because if there
positive
was a
family
positive
history,
family
I mean,
history, I mean,
like mother was
like
affected,
mother was
father was
affected,
affected
father
in a
was
female,
affected in a
then it's
female,
we
then
think about
it's
the
we
DEXA.
think
But
about
this
the DEXA.
person
But this
is
person
wife
is
affected,
wife
but they're
affected,
not
but
related
they're
to
not
blood.
related to blood.
Yeah, they're not
Yeah,
related to
they're not
blood.
related to blood.
So in that case,
So in
what to
that
do?
case,
And
what
let
to
me
do?
repeat
Let
again.
me repeat again.
A previous
A
recap
previous
question was
recap
there.
question was
I
there.
hope you
I
remember
hope you
which one.
remember which one.
We directly
We
did the
directly did the
DEXA scan
DEXA scan
because there was a
because
positive
there was a
family
positive
history.
family history.
My mother
My
was
mother
suffering with
was suffering with
osteoporosis.
osteoporosis.
Right. Now,
Right. Now,
here,
here,
um, is there anything
is there
mentioned like
anything
that? His
mentioned like that?
wife
His
that is
wife
affected,
that is affected,
they're not blood
they're not
related.
blood
They're not
related.
relation
They're not
related. Husband wife, they are
related.
like
Husband wife, they are
soulmates,
like
but not
soulmates, but not
blood related. So,
blood
in
related.
that
So,
case,
in that
is
case,
it necessary
is
for
it
the
necessary
male
for that
person
male
particularly
person
to
particularly to
have
have
bone mineral
bone
density
mineral
test? Yes.
density test?
No.
Yes. No.
So,
So,
what the person
what
can
the
go
person
through,
can go through,
so it is
so
something
it
for the
is something for
screening.
the
Now, the
screening.
person
Now,
wants
the person
something for
wants
the
something for the
osteoporosis. Is vitamin
osteoporosis. Is
D
vitamin
will
D
give
will
you
give you
a view
a
for
view for
osteoporosis? Not
osteoporosis?
really.
Not really.
Is vitamin D
Is
is going to
vitamin
give
D is
him
going to give him
a view? Vitamin
a
D,
view? Vitamin D,
see, vitamin D is
see,
not
vitamin D
necessary
is not
for
necessary
bones.
for
Do you agree? For
bones. Do you
our
agree? For
many
our
molecular
many
things,
molecular
it
things,
started with your
it started with
skin,
your
started with
skin,
your
started with your
feeling well,
feeling well,
not feeling less
not
fatigued.
feeling less
So many
fatigued.
things
So
vitamin
many
D
things
is
vitamin
related. So
D is
don't always
related. So
think that
don't always
vitamin
think that
D
vitamin D
is only related
is only
to
related
bones.
to
Vitamin D is
bones.
related to
Vitamin D is
many other
related to many
things.
other things.
Many other things.
Many
So I
other
can tell.
things. I can tell.
Immunity is starting with
Immunity is
many
starting
things.
with many
So
things.
vitamin
So
D
vitamin
covering is
D
a different
covering is a
thing, and
different thing,
someone
and
who
someone
expresses
who
wish because the
expresses
person
wish
is
because the
almost
person is
70,
almost
is he
70,
having any
is he
kind
having
of
any
bone
kind of
loss?
bone
So
loss?
vitamin D
So
probably
vitamin
will
D
not
probably will not
give you clear view,
give
and
you
he's
clear
asking
view,
for
and
his
he's
screening
asking for
test.
his
So
screening
can
test.
you see
So
that the
can you
patient
see
is
that the patient
requesting
is
here?
requesting
So
here?
if the patient is
So if the patient
requesting,
is
we may
requesting,
not go
we may
for
not go
bone
for bone
bone mineral
like
density
bone
test,
mineral
but
density
certainly we
test,
can
but
go for a
certainly we can
simple
go for a
X-ray
simple
because he may
X-ray
have
because he
a
may have a
back pain
back
or
pain
any
or
changes or
any
something like
changes or
that. So
something
doing
like
a
that. So
simple
doing a
X-ray
simple
instead
X-ray
of the
instead
spine
of the
is not a bad
spine is
idea.
not a bad
Clear?
idea. Clear?
No, it can give you
No,
an
it can
idea.
give you an idea.
Doing X-ray.
Doing
Okay, quick
X-ray.
question.
Okay, quick
Can we
question.
see
Can we
or
see
do
or
we have
do we have
finding
finding
in
in
X-ray for
X-ray for
osteoporosis? A quick question.
osteoporosis? A quick question.
Do you have
Do you have
like
like
osteoporotic? Yeah,
osteoporotic? Yeah,
osteopenic changes are
osteopenic
quite
changes
visible
are
in the
quite
X-ray.
visible
So
in the
based on
X-ray.
that
So
one,
based
later
on
you
that
can go
one, later you
for
can go for
things like that.
things
Because
like that.
many time
Because
in Australia
many
this
time
thing
in
happens.
Australia
Like
this thing
someone came to
happens.
the
Like someone
GPO,
came to the
my friend
GPO,
is having
my
this
friend is
problem, my
having
friend
this
is having
problem, my
prostate
friend is having
problem. Tell
prostate
me this,
problem.
that.
Tell me this, that.
Yeah.
Yeah.
So those are
So
important.
those are important.
If I add an
If
option,
I add an
option D,
option D,
that tell
that
the
tell the
person about the pros
person
and
about the
cons
pros
about
and
the
cons about the
osteoporosis. What
osteoporosis.
do you think?
What do you think?
I mean, D,
I
if
mean,
I make
D,
a
if I make a
additional point,
additional point,
tell the patient more
tell the
about the
patient more
pros and
about the
cons of the
pros and cons of the
osteoporosis, then it
osteoporosis,
will be the
then
D.
it will be
So
the
you
D.
understand? I
So you
mean,
understand?
a
I
different
mean,
types
a
of
different
questions
types of questions
they
they
prefer in the exam.
prefer
So
in the
here I
exam.
think
So
that
here
X
I
is
think
better
that
because
X
the
is
person
better
is
because
looking
the person
forward
is looking
a
forward
little bit
a
answer, and
little
the
bit
person is
answer,
already
and the person is
70. So
already
there
70. So
is
there
a
is a
possibility some
possibility
changes
some
can be there
changes
actually.
can be
So
there
X-ray
actually. So
spine
X-ray spine
is a little
is
bit
a
more
little
important
bit
because
more
the person
important
is
because the person is
requesting here. I
requesting
repeat,
here. I
the
repeat,
person is
the person
requesting
is
here.
requesting here.
All right. So here
All
is
right.
the
So here is
lineup:
the lineup:
X-ray,
X-ray,
vitamin D assay,
vitamin D assay,
DEXA.
DEXA.
Now, D, I'm
Now
not telling. I
D,
mean,
I'm not
D,
telling. I mean
I'm
D,
telling
I'm
if
telling if
hypothetically.
hypothetically.
Understand what I'm saying?
Understand what I'm saying?
Yeah. Forget about
Yeah.
D.
Forget about D.
Count between A, B,
Count
C.
between A, B, C.
D
D
hypothetically actually.
hypothetically
Sometimes
actually.
with prostate
Sometimes
we have
with
seen
prostate we
questions
have
like
seen
that.
questions like
That
that.
sometimes
That
they
sometimes
just
they
wanted
just wanted
to
to
give a different
give a
answer.
different answer.
Great.
Great.
So as you can
So
see,
as
so
you can
this is the
see, so this
lineup
is the lineup lineup for regular
So if
actually.
you go to any
So if you go
orthopedic
to any
doctor,
orthopedic
they may
doctor,
not give you
they may
vitamin
not
D
give you
test, but they
vitamin
will
D
give you
test,
an
but they will
X-ray.
give
Do
you
you
an
agree?
X-ray. Do you agree?
If you go for an
If you go
orthopedic
for an
doctor
orthopedic
complaining
doctor
about the back
complaining about the
pain,
back
they'll
pain,
give you an
they'll
X-ray
give
for
you an
sure,
X-ray for sure,
rather than giving the
rather than
vitamin D,
giving the
honestly.
vitamin D, honestly.
So the lineup
So
is
the
like that:
lineup is like that:
X-ray,
X-ray,
then the vitamin
then the
D,
vitamin
then
D,
comes the
then
DEXA.
comes the
Is it
DEXA.
clear now,
Is it
everyone?
clear now, everyone?
clear now, everyone?
Clear now, everyone?
This is actually the
This is
line.
actually the line.
Yeah. Now clear?
Yeah. Now clear?
Yes.
Yes.
Okay.
Okay.
Similar question,
Similar question,
osteoporosis type of
osteoporosis
question.
type of
So,
question. So,
in that case, I
in
think
that case, I
again
think again
breast cancer history.
breast
So
cancer
I think
history.
it's
So I think
raloxifene.
it's raloxifene.
Yeah.
Yeah.
34 it's again
34. It's again
raloxifene D.
raloxifene D.
Yeah. Just quickly
Yeah. Just
checking. Let
quickly
me
checking.
talking
Then
similar kind
talking
of
similar
question.
kind of question.
Okay. Have a look.
Okay. Have a
Again,
look.
have a look
Again,
quickly.
have a look quickly.
We just need to
We
check the
just need to
score
check
and we
the
need to
score
check
and
if
we
there
need
is
to
any
check if there
cancer
is any
somewhere.
cancer somewhere.
So it's a
So it's a
osteoporosis.
osteoporosis.
So
It's a
osteoporosis. So
osteoporosis.
definitely
So
L
definitely
androgen
an
actually.
androgen actually.
Okay.
Okay.
Keep it in mind,
Keep it in
alendronate,
mind,
this
alendronate,
alendronate,
this
usually we
alendronate,
mean by
usually we mean
IV.
by IV.
Usually we mean by
Usually we
IV
mean by
because
IV because
if somewhere
if
they break
somewhere
down
they
things,
break down things,
oral and IV,
oral and
IV is
IV,
more
IV
preferred,
is more
especially
preferred.
cases like
Especially
this, they have
cases like
given
this, they have given
esophageal operation
esophageal
sometimes.
operation
If
sometimes.
esophageal
If
operation, you
esophageal
cannot
operation,
give
you
the
cannot
oral
give the
actually.
oral
I
actually.
hope in main
I hope
exam they
in
will
main exam they
clarify
will
this kind of
clarify this kind
statements
of
actually, like
statements actually,
are they
like
mean
are
like
they
a
mean like a
IV or not
IV
actually.
or
Yeah.
not
So
actually.
I
Yeah.
think normally
So
we
I think
mean this
normally we mean
alendronate
this
by
alendronate
IV
by IV
alendronate.
alendronate.
Okay. We're
Okay.
tired of this
We're tired of this
osteoporosis. Let's get out
osteoporosis.
of
Let's
this
get out
particular
of this
concept.
particular
Again,
concept. Again,
raloxifene. Again,
raloxifene. Again,
questions. Raloxifene. Yes.
raloxifene. Yes.
37 is also
37 is
same.
also same.
Then
Then
there's a one
there's a
with
one with
38.
38.
Yeah, we'll go for a
Yeah,
break.
we'll go
Yeah.
for a break.
I mean,
Yeah.
I'm just
I mean, I'm
skipping
just
these
skipping these
particulars.
particulars.
39, you can
39,
put
you
it as a
can put
D.
it as a D.
Yeah. Let's just
Yeah.
finish this
Let's just finish this
osteoporosis once.
osteoporosis once.
Yeah. It's
Yeah.
again
It's
not
again
a difficult
not a
one.
difficult one.
Osteoporosis and
Osteoporosis and
alendronate.
alendronate.
Yeah. And you're
Yeah.
saying,
And you're saying,
yeah, I think you can
yeah, I
read
think you can
38.
read
Yeah.
38. Yeah.
Yeah. Check and answer,
Yeah. Check and
guys.
answer, guys.
5 year ago
5 year
menopause, so
ago
maybe
menopause, so
55
maybe
years.
55 years.
I think preferred
I
is an
think
extra.
preferred
We
is an
start,
extra.
we
We
can
start,
have a
we
fresh
can have
start.
a fresh
What will
start.
you do
What will
as
we
like
do
initial
as like
screening? We will
initial
start with
screening?
the
We will
next
start
one.
with the
Very
next one.
simple.
Very simple.
Yeah.
Yeah.
So I think it's break
So I
time,
think it's
and
break
after
time,
that
and
there will
after
be
that there will be
new set of
new
questions are
set of
coming.
questions are
Okay.
coming.
But
Okay.
I'm sure
But
that you know
I'm sure
this
that this
osteoporosis thing will
osteoporosis
not
thing will not
hamper you in
hamper
future,
you in
right?
future,
I hope
right?
so.
I
So I
hope
give
so.
you a
So I
brief
give you a
idea,
brief
already given
idea,
you a
already
brief
given you
idea.
a brief
In
idea.
future, in
In
gynaeops,
future,
it
in
will come
gynaeops,
again.
it will come again.
And don't worry,
And
I mean,
don't
now
worry,
there
I
will
mean,
be
now there'll
gout,
be
pseudogout,
gout,
and some of the
pseudogout, and
other
some of the other
rheumatological things will be
rheumatological
there.
things
It's
will be
coming up
there. It's
shortly.
coming up
We're going
shortly.
for a break.
We're going for
Actually,
a
thank
break.
you guys.
Actually, thank you guys.
All right. So
All
we do
right.
have a
So
break.
we do have a
We'll be
break.
back.
We'll
We'll
be
keep on
back.
thinking.
We'll keep on thinking.
Alright, everyone,
All
let's
right,
get
everyone,
started.
let's get started.
Sure you're ready?
Sure you're ready?
We're going to start.
We're going to start.
20 more questions.
20 more
21
questions.
more
21 more questions.
A female patient
A
with a
female
gout
patient with a
already
gout
on
already on
haloperidol presented
haloperidol
with
are
the
presented
acute
with the
nodular
acute nodular
tophi.
tophi.
Tophi you can
Tophi you
understand.
can understand.
If there is a
If there
gout,
is a gout,
and if this is
if this is
other fingers
other
and this that.
fingers and this that.
Alright.
All
So
right. So
some cases there is
some
a like
cases there is
extra
a like
additional
extra
tophi.
additional tophi.
Most important
For us to
know like
know
about the
like about
tophi.
the tophi.
If it's
If
present
it's
in the
present in
question,
the question,
is it
is
indicating
it indicating
acute or
acute or
chronic?
chronic?
That's most
That's
important
most
for the
important for the
questions,
questions,
right?
right?
So
So
probably it indicates
probably it
the
indicates the
chronicity,
chronicity,
chronic. That
chronic.
means your
That
treatment
means
and
your
things based
treatment
on
and things
because
based on because
we can see the
we can
E
see
options are
the E
missing,
options are
so
missing. So
we can understand
we
it
can
will be
understand
based
it will
on
be
the
based
acute
on
and the
the acute
chronic
and the chronic
treatments will be mentioned.
treatments will be
So
mentioned. So
increase the dose of the
increase the dose of the
allopurinol and
allopurinol and
certain options are
certain
given.
options are
So
given. So
in that case, I
in that
think as
case, I
like most
think
of
as
you,
like
I
most
think
of
already
you,
on
I think already
allopurinol.
on allopurinol.
So what you do in that
So
case,
what you
because
do in
it's a
that case, because
chronic
it's a
case, we
chronic
don't have
case,
any
we don't
acute
have any
issues.
acute issues.
So we increase the
So
dose
we
of the
increase the dose
allopurinol.
of the allopurinol.
Do you agree on
Do
this
you agree
point
on
that
this
a
point that a
drug like
drug like
allopurinol, the
allopurinol, the
dose needed to be
dose needed to
adjusted?
be
I think
adjusted?
maybe some
I
of
think
you
maybe some of you
probably
probably
gout patient, I
gout
don't know,
patient, I don't
but
know,
we have
but
seen a lot of
we have
patients
seen a lot of
actually. But
patients actually. But
this allopurinol
this
thing was
allopurinol thing
started a
was
lot of
started a
time.
lot of
It
time.
required
It required
adjustment actually.
adjustment
Most
actually.
cases like
Most cases
there might
like
be
there might be
needed to increase the
needed to
dose
increase the
actually.
dose
Correct.
actually. Correct.
So first of all, there
So
is no
first of all, there
severe
is
pain.
no
This is
severe
not an
pain. This
acute
is not
case
an
of gout.
acute case of gout.
Somebody here, the
Somebody
patient
here,
is
the
already
patient
on
is already on
allopurinol
allopurinol
and the person
and
has
the person
tophi.
has tophi.
So this
So
looks like
this
probably
looks
a
like probably
treatment
a
failure
treatment
case.
failure case.
So treatment
So
failure
treatment
case
failure
and
case
there
and
is a tophi
there
which
is a
has been
tophi which
developed
has been developed
in spite of
in spite
allopurinol.
of
So you need to
allopurinol. So you
increase the
need to
dose of the
increase the dose
allopurinol.
of the
Holding here
allopurinol.
for
Holding
a
here
few
for
seconds.
few seconds.
Let's check it.
Let's check it.
Yep.
Yep.
It's not a chronic
It's not a
case.
chronic case.
So
So
its mainstay.
its
It's a
mainstay.
treatment
It's a
failure
treatment
case.
failure case.
So this
So this
chronicity,
chronicity,
this
this
tophi, you don't
tophi,
want this
you
thing to
don't want
happen
this thing
because
to happen
there are
because
so
there
many,
are so many,
you know,
you know,
crystal has been
crystal has been
deposited.
deposited.
So it's mostly a
So it's
chronic
mostly a
case.
chronic case. We yeah.
So mostly a
So
chronic case.
mostly a
Already
chronic
on
case. Already
allopurinol,
on
nothing
allopurinol,
mentioned about
nothing
a
mentioned
pain.
about a pain.
Okay.
Okay.
If you have any
If you
interesting
have any
question,
interesting question,
we do have our
we do have our
inquiry
inquiry
zone open. Feel
zone
free to
open.
ask
Feel
me
free to
the
ask me the
important questions
important
actually there.
questions actually there.
Okay.
Okay.
So gout
So
scenario
gout
now presents
scenario
with
now
acute
presents with
symptom
acute
of
symptom of
pain in the first
pain in
millimeter.
the
So
first
lab
millimeter. So
shows
lab shows
urate level
urate level
increase
and
and creatinine is 1.8,
creatinine is
not mentioned
1.8,
renal
not
failure.
mentioned renal failure.
Just give creatine
Just give
value, what to
creatine
give
value,
in this
what to give
case.
in this case.
Creatinine is
Creatinine
1.8.
is
Why does there's
1.8. Why
normal
does there's
creatinine?
normal
Some people
creatinine?
ask me
Some
this
people ask
question.
me this
Is
question.
normal values
Is
are
normal
given?
values are
Most
given?
cases
Most
normal values
cases
are
normal
given.
values are given.
But some rare
But
cases
some
like
rare
sodium,
cases like
potassium,
sodium,
calcium,
potassium,
these
calcium,
cases
these cases
normal values may
normal
not be
values
given
may not
actually.
be given actually.
Too much
Too
normal things
much
may not
normal
be
things
given.
may not be given.
Now coming to this
Now
one,
coming
is
to
the
this one
acute
is the acute
pain is present.
pain
They
is
stand with
present.
the
They
urate level
stand with the
increase,
urate
which is
level
also
increase, which is also
indicator of gout.
indicator of gout.
Now just have to be
Now just
sure
have to be
that
sure
what
that
kind of gout
what
it is.
kind
This
of
is
gout it is.
acute
This is
gout
acute gout
class,
class
like
kidney problem, acute gout
plus
plus
kidney
kidney
problem.
problem.
Our
Now,
choice would
our
be
choice would
here.
be
Some
here.
people answering
Some
C, I
people
don't know
answering
why.
C, I don't know why.
Is creatinine is
Creatinine is
1.8. Is
1.8.
it
Is
recommended
it recommended
naproxen?
naproxen?
It's a matter to
It's
think
a matter
like
to
it.
think like it.
NSAIDs.
NSAIDs.
So this is
So this is a
false
false
NSAIDs.
NSAIDs
Contra
contra
indicated. So
indicated.
can't
So
give
can't give
NSAIDs here in any way.
NSAIDs here in any way.
Right. Because creatinine is high.
Creatinine is high.
Kidney
Kidney
issues is there. Gout related.
Gout related.
I
I think
um,
um,
here is a page
here is a page which I
collected from
collected
Master
from
Tipo.
Master Tipo.
It's a nice book.
It's a nice book.
Sometimes
Sometimes
can open
can
on and off.
open
It's
on and off.
nice.
It's nice.
But if you
But
focus,
if you
example, if
focus,
it's
example,
something
if it's
related to
something related to
um,
um,
like John
like
Murtagh and
John
S7
Murtagh and
that comes
S7,
first
that
actually.
comes first actually.
Okay.
Okay.
So here we go.
So here we go.
So you can see
So
one
you can
thing,
see one thing
what we are trying
what
to
we are
talk
trying to talk
and add here.
and add here. Like
Tophi is an
tophi
indicator
is
of
an
chronic
indicator of
gout.
chronic gout.
Tophi,
Tophi, any form of tophi is an indicator
of chronic gout,
of
not a sign
chronic
of
gout, not a sign of
acute gout. This is
acute gout.
important
This
for
is
us.
important for us.
Uric acid is a
Uric acid is a
non-specific test, but
non-specific test,
even
but
this gives
even
us
this
a
gives us a
sign of
sign
acute
of
attack. So,
acute attack.
and
So,
alongside
and
elevated
alongside elevated
ESR and
ESR
WBC
and
counts.
WBC counts.
Some cases we might
Some
need
cases we
joint
might need joint
expeditions as well.
expeditions as well.
We also do an
We also
X-ray
do an
to
X-ray
see
to see if any
radiological
finding
there or not.
there or not.
Must be remember
Must be remembered
alongside
alongside
rheumatoid
there was a
radiology of gout
radiology
as
of
well.
gout as
There
well.
was
There was
erosion by the
erosion by the.
Now here's a little
Now here's a
treatment.
little treatment.
So NSAIDs
So
are
NSAIDs
mainly
are
for the
mainly
acute
for
gout,
the acute gout,
whereas
whereas
alternatives are
alternatives are
corticosteroid.
corticosteroid.
If there is some
If there is
obligation
some
for
obligation
NSAIDs
for
actually or any
NSAIDs
kidney
actually or any
problems,
kidney problems,
in that case
in that case
corticosteroid.
corticosteroid.
Another
Another
thing is here
thing is here
colchicine. Now we can
colchicine.
see
Now we can
colchicine is
see
also
colchicine is
treatment
also
for
treatment for
acute gout
acute gout
in cases
in
where
cases where
NSAID and
NSAID
steroid
and steroid
both together you
cannot
give in some
cannot give in
cases.
some cases.
Right? So in that cases,
So in that cases,
colchicine can be
be
a good idea.
a good idea.
One more
One
slide
more
here
slide here
regarding
master the board.
master the board. Yeah.
Yeah.
Now some
Now,
drug
some drug can
gout.
cause gout.
Correct. It's like
Correct?
example
It's like
thiazide
example thiazide
can leads to
can leads to
hyperuricemia.
hyperuricemia.
So if
So,
any
if any
drug
drug
induced
induced
gout,
gout, the first
in
thing
the management
in
would
the
be to
management would
stop
be to
the
stop
offending agent.
the
I'm
offending
sure,
agent. I'm sure,
many
many
stop
stop the offending
agent related
agent
questions we
related
have seen in the
questions we
past.
have
So this is
seen in the
another
past. So, this is another
stop the offending
stop
agent.
the
Now,
offending agent.
a
Now,
quick
a quick question.
Can you
Can you use
like the
like the
colchicine?
colchicine?
Can you use the
Can you use the
colchicine
colchicine in
acute and chronic?
acute and chronic? Mostly it's a treatment related to acute. Some cases,
Chronic, if already
chronic,
patient
if
is
already
taking that
patient is
drug, they
taking
can
that drug,
continue.
they can continue.
Now,
Now,
there is a popular
there is a
question.
popular question.
There was kidney problem.
There
There
was
was kidney problem
kidney
at the same
problem
time
at the
Cushing
same time
syndrome.
Cushing syndrome.
So in
So,
that case,
in that case, can we give
these two drugs,
this two
NSAID
drug,
and
NSAID and
corticosteroid?
corticosteroid? So,
Kidney
kidney
problem
problem
and
and
Cushing syndrome.
Cushing
So I
syndrome.
think
So, I
for
think
both
for
cases,
both cases,
it's not applicable.
it's not
So
applicable. So,
kidney problem and
kidney
ulcer
problem and
together
ulcer
often given
together often given kidney
Cushing
problem and
syndrome. So
Cushing
these
syndrome. So,
two
these two
may not be
may not be
In
applicable.
that case,
In that case, colchicine,
better word to
better
say
word to say, low dose colchicine
is because
is because
when you have renal
impairment, can you give
the
drug in a normal
and
dose
salicylate.
and salicylate?
So
So, colchicine in a low dose in
where you
where you cannot use
corticosteroid,
corticosteroid, please take
take
a
a
note
note
on that actually.
Okay.
Okay.
So here a few
So
points
here
are
a few
given.
points are given as well.
Yeah.
Yeah.
Salopidinol,
Salopidinol,
febuxostat,
similar
types of drugs.
Anyways,
These are some of the
discussion and information regarding
gout
the
actually.
gout actually.
Okay.
Okay.
In this our
previous one, our answer was
prednisone
actually.
Because it was a
Because it was a different question, my dear.
Okay.
Okay.
But your question
but
can
your
come
question can
at
come at
second, third,
second,
fourth layer
third,
of
fourth layer
questions.
of questions.
So I'm giving
So I'm
you some
giving you
additional
some
information
additional
actually.
information actually.
Okay, as we
Okay,
said,
as we
do
said,
not
do
overthink
not
things
overthink
too much
things
actually.
too much actually.
Some things can
Some
be
things can
learning
be
objective. My job
learning
is not
objective.
to
My job is
just
not to
give this
just
one,
give
okay,
this one,
answer this,
okay,
this, and
answer
this,
this,
but
this, and this,
to
but
try guide
to
you a
try
little bit
guide you
more
a
in
little
that
bit
case
more in
actually.
that case actually.
Alright. Here,
Here,
why
why
prednisone? Okay,
prednisone?
that's
Okay,
interesting.
that's interesting.
If someone
If someone
didn't get it,
didn't get it,
do we have
do we
any
have
problem
any
or any
problem or any
obligation
obligation
related to
related to
Cushing syndrome
Cushing
or
syndrome
any
or
ulcer
any
issue
ulcer issue
to avoid the
to avoid
prednisolone?
the
That's the
prednisolone?
basic
That's
question.
the basic
No.
question. No.
Suppose then why we
Suppose
will
then why
stop
we will
the
stop
prednisolone?
the
Because
prednisolone?
prednisolone
Because
already
prednisolone
mentioned when
already
you cannot
mentioned
use
when you
NSAIDs,
cannot
we
use
prefer
NSAIDs, we prefer
prednisolone. So as
prednisolone.
a
So
second
as a
layer,
second layer,
yeah,
yeah,
second layer of
second layer
cases,
of
we
cases,
can use
we
go
can
for
use
that.
go for that.
Yeah,
Yeah,
prednisolone. Now a
prednisolone.
question
Now,
can
a
come
question
like
can
some of
come
you
like
might
some of
think,
you might think,
why not
why
maybe
not maybe
allopurinol? A very
allopurinol?
interesting
A very
fact about
interesting fact
allopurinol.
about
Can
allopurinol.
you give
Can you give
allopurinol
allopurinol
in
in
acute pain
acute pain
cases? I
cases?
repeat,
I
can you
repeat,
give
can you give
allopurinol in
allopurinol
acute pain
in
cases? Now,
acute pain cases? Now,
interestingly,
interestingly,
the answer is
the
a
answer is a
no. Now, why
no.
it's
Now,
no?
why it's no?
Allopurinol
Allopurinol
never
never
in
in
acute gout.
acute
Now,
gout.
if you give
Now, if you
acute
give acute
acute
allopurinol
gout,
acute gout,
there are
there are
crystals.
crystals.
So it usually
So it
break down
usually
the
break
crystal.
down the
So already
crystal.
there is
So already
pain,
there is
and
pain,
if you increase
and
the
if you
pain
increase the
again
pain
five more
again five
times,
more times,
may not
may
sound
not
very well.
sound
The
very
patient
well.
might
The
sue you
patient might sue you
because of pain
because
actually.
of pain
So there'll
actually.
be
So there'll be
and
and
remember
whenever
one thing in
remember
your
one thing in
practice. I
your
mean, I'm
practice.
sure
I
some
mean,
of
I'm
you you
sure
are
some
good
of you you are
practitioner
good
and already
practitioner
knew
and
about
already
it.
knew about it.
Whenever we give
Whenever we give
allopurinol to a
allopurinol
person,
to a person,
even the gout
even the
is
gout
controlled.
is
We
controlled.
tell the
We
patient
tell the
clearly, I'm
patient
giving this
clearly, I'm
drug,
giving
and
this
this
drug,
drug
and this drug
may increase your
may
pain a
increase
little
your
bit.
pain a
And
little bit.
how we need
And
to
how we
explain
need
that
to
to them,
explain
that
that
it's
to them,
like
that it's
crystal,
like
they
crystal,
like to break it
like to
down,
break it
and they will
down,
try to
and they
clear
will
it
try to
through
clear
the
it
renal
through
system.
the
But
renal
initially, you
system. But
might feel a
initially, you
little
might
bit
feel a
pain.
little bit
We
pain.
need to mention
We need
that
to
one. So on the
mention that
top
one.
of
So on the
acute
top
gout,
of acute
never
gout,
give
never give
allopurinol. Is it clear
allopurinol.
now,
Is it
guys?
clear
This
now,
question?
guys? This
I
question?
hope that
I hope that
is yes.
is yes.
Well done.
Well done.
Okay, next, all
Okay,
men
next,
came
all
with
men
a
came with
symptom
a
of
symptom
MI,
of
got
MI,
admitted,
got
treated for the
admitted, treated for
same,
the same,
and after
and
2 days
after two
hospitalized and
days
swelling
hospitalized
of
and
the
the
grade 2
swelling of the
shiny
grade 2 shiny
appearance,
appearance,
grade 2 with shiny
grade 2 with
appearance, it's
shiny
a
appearance,
loud
it's a
clear view.
loud, clear view.
Yes. So,
Yes. So,
diagnosis.
diagnosis.
So gout will have a
So
lot of
gout will have a lot of
presentation like
presentation like
ouch.
ow,
I
ouch.
remember
I
like in
remember like
China,
in
like
China, like
I was going
I
through a
was going
bus.
through a
I mean,
bus, I
night
mean,
bus.
night
I
bus.
saw two
I saw
kids were
two
like,
kids were like,
jumping here and there, and
jumping
one
here
of
and there,
them
and one of them
fall down and
fall
then
down and
just
then just
shouting like that,
shouting like
I.
that, I.
So anyway, so
So anyway, so
gout can be
gout can be
presenting or pain can be
presenting or pain
presenting
can
in
be
a lot of
presenting
way,
in a
like
lot
as
of
a
way,
ow,
like as a
ouch,
ow,
I, or
ouch,
how,
or how.
Anyways, coming back
Anyways,
to that
coming
one,
back to that one,
as a
as a
diagnosis, which
diagnosis,
one do you think is
which
the
one do you
right
think
answer?
is the
So
right
our right
answer?
answer
So our
here
right
looks
answer
like
here looks like
quite a loud and
quite
clear,
a
and
loud and
this one
clear,
is a
and
very
this one
clear
is a
case
very
of
clear case of
gout.
gout.
Grade 2 with
Grade
shiny
2 with
appearance.
shiny
That
appearance.
is the
That is the
very clear
very
finding for
clear
us.
finding for us.
Okay,
Okay,
treatment and the
treatment and
references
the
given
references
has
given
been forgiven.
has been forgiven.
Next question.
Next
Gout with
question.
a
Gout with a
CRF chronic renal
CRF
failure
chronic
now
renal
presents
failure
with
now
acute
presents with
symptom.
acute
So what to
symptom.
give?
So what to give?
You're supposed to
You're
answer this
supposed to
one.
answer
Your
this one.
eyes might be
Your
looking
eyes
for
might
to
be looking for to
prednisolone, which is not
prednisolone,
there.
which is not there.
So if that is
So
not
if that
there,
is not there,
and still for the
and still for
acute,
the acute,
we can give
we can give
colchicine. Now, is it a
colchicine. Now,
normal
is it a
colchicine
normal
or a low dose
colchicine
of
or a low
colchicine?
dose of colchicine?
We give a
We give a
low dose of
low
colchicine.
dose of colchicine.
So we prefer.
So we prefer.
So this time is
So this time
it's
is
from
it's
John
from
Mutta.
John
So
Mutta.
colchicine
So
can be given.
colchicine can be given.
Low dose of
Low
colchicine.
dose of
Please
colchicine.
remember
But
this is
please remember
another
this is
handbook
another
question.
handbook question.
Previous
In
John
previous
Mutta
John Mutta
also given
also
that
given
colchicine
that
can leads
colchicine
to
can leads to
diarrhea. Did you find
diarrhea.
this
Did you find
information
this
anywhere?
information anywhere,
So
guys.
purchasing
So
is a
purchasing is a
condition
condition
that can lead
that
to
can lead
diarrhea
to
today.
diarrhea
Very
today.
important. So
Very
you can see
important. So you
acute
can see
case,
acute
you
case,
can give
you can give
NSAID, you
NSAID,
can give
you can give
prednisolone, you
prednisolone,
can give
you can give
colchicine, but
colchicine,
low
but
dose
low
preferred.
dose preferred.
You don't need to
You
remember
don't need
the
to remember the
dose.
dose.
Next time, they
Next
already
time,
mentioned
they already
chronic gout,
mentioned
but
chronic
many
gout,
times
but
they may
many
not
times they may
mention.
not
By
mention.
the way, from the
By the way,
scenario
from
you
the
need to
scenario you
understand.
need to understand.
So how we
So
understand
how
from the
we understand
scenario?
from the scenario?
Um,
Um,
Already previous attack
Already
of gout,
previous
now
attack of gout,
taking
now
drug
taking
for chronic,
drug for
or
chronic,
patient is
or
already
patient
having
is already
tophi and
having
this that, they
tophi
will
and
give
this
you
that, they will give you
sign symptom to
sign
understand
symptom
if
to
it's a
understand
chronic
if
gout.
it's a chronic gout.
Or they will
Or
mention
they
from the
will mention
beginning
from
this
the
is chronic
beginning
gout.
this is chronic gout.
Coming to
Okay,
this question,
coming to this
chronic
question,
gout patient who is
chronic gout
already on
patient who is already
allopurinol,
on allopurinol,
100 mg
100 mg
and intermediate
and
whole
intermediate
G.
whole
So
G.
patient has
So
renal
patient has
impairment.
renal impairment.
Fluid level normal,
Fluid
what will
level
be the
normal, what will be
next
the
appropriate?
next appropriate?
Are you going to give
Are you going
daily
to give
colchicine
daily colchicine
or
or
dose or
dose
increased role
or
of the
increased role
allopurinol?
of the
Answer:
allopurinol?
we increase the
Answer,
dose of
we increase the
allopurinol.
dose of
You don't
allopurinol.
need to
You
stop
don't need to
the
stop
allopurinol
the
dose
allopurinol dose
if gout is
if
not
gout
controlled.
is not
Rather,
controlled. Rather,
we may
we
need to
may need
increase the
to
dose of the
increase the
allopurinol
dose of the
because
allopurinol
your
because
treatment
your
is not
treatment
working
is
with
not working
allopurinol.
with allopurinol.
All right.
All right.
So daily
So daily
colchicine
colchicine
is not
is
recommended,
not
as you
recommended,
all
as
can
you
see.
all can see.
Daily colchicine not
Daily
recommended.
colchicine
Already
not
on
recommended.
allopurinol,
Already on
so
allopurinol,
no
so
need to
no
change,
need to
even if
change,
kidney
even if
problem
kidney problem
happened actually.
happened actually.
Next, gout
Next,
scenario with
gout
chronic renal
scenario with
failure,
chronic renal
and
failure and
CCF mean
CCF mean
congestive cardiac
congestive
failure.
cardiac
Now
failure.
presents with
Now
acute
presents
symptom
with
of
acute
gout,
symptom of gout,
what to
what
give?
to give?
Questions are getting
Questions are
intense
getting
more
intense more
and more with
and
time.
more with time.
Again,
Again,
so no
so
steroid in
no
the
steroid
option.
in the
So
option.
we are going
So
for
we are going for
colchicine.
colchicine.
If we have
If we have
steroid in the
steroid
option,
in the option,
corticosteroid,
corticosteroid,
that would have been your
that would
answer.
have been your answer.
Next,
Next,
acute attack of
acute
rheumatic
attack
knee
of
pain in
rheumatic
an
knee
oldie
pain in an
means
oldie
elderly
means
person.
elderly person.
In your
In
classification, what
your
is the
class,
most
what
likely
is the most
diagnosis? No
likely
redness,
diagnosis? No
tendinitis,
redness, tendinitis,
proparistal
proparistal
osteoarthritis, no fever.
osteoarthritis, no
So,
fever.
what is your
So, what is your
probable
probable
diagnosis?
diagnosis?
Please keep it in
Please
mind.
keep it in
This is
mind. This is
elderly. So
elderly.
before thinking
So
about
before thinking
ankylosing
about
spondylitis,
ankylosing
think
spondylitis,
double. Is
think double.
ankylosing
Is
spondylitis
ankylosing
common in
spondylitis common
elderly?
in
Not
elderly?
really.
Not
Now,
really.
so in this
Now,
case,
so in this
this is
case, this is
pseudo gout.
pseudo gout.
So you
So
can see
you
one
can
thing.
see one thing.
This person
This
already have
person
a
already have a
pre-existing
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 joint problem
joint problem
and
joint problem
elderly
and
and
elderly and
unilateral. So this is a
unilateral. So this is a
monoarthritis case.
monoarthritis
Do you
case.
agree?
Do you agree?
This is a
This is a
monoarthritis. I mean,
monoarthritis.
later
I
the
mean,
problem we
later the
found.
problem we found,
I mean, acute
I mean,
problem we
acute
found is a
problem we found is a
monoarthritis problem, and
monoarthritis problem. And
previously there was a
previously
joint
there was a
problem
joint
disease.
problem
So now
disease. So now
monoarthritis, and
monoarthritis and
already there
already
is a
there is a
known joint
known
problem. So
joint
on the top
problem.
of
So on the
known
top
joint
of known
problem,
joint problem
in a 50
in a
plus,
50
so our
plus.
answer will
So our
be
answer will be
zero.
zero.
Pre-existing joint
Pre-existing
problem,
joint
now
problem.
newly developed
Now
some
newly developed
problem.
some problem.
In
In
unilateral knee, it
unilateral
will
knee,
be
it will
possibly
be
pseudogout.
possibly
Now, if the
pseudogout.
same
Now, if the
question is
same question
probably
is probably
associated with
associated with
fever,
fever,
pain, and
pain, and
unilateral
unilateral
joint pain,
joint pain,
swelling, and
swelling,
fever,
and fever,
then what you
then
have been
what you
thinking
have been
is
thinking
a
is
septic
a septic
arthritis, right?
arthritis,
So you
right?
can think
So
like
you can
already
think like
defective
already
joint,
defective joint,
septic, or
septic,
pseudogout
or
can
pseudogout
happen.
can happen.
Can you able to
Can you able to
differentiate now?
differentiate now?
Septic and the
Septic
pseudogout
and the
one. I'm sure
pseudogout
it
one.
is a
I'm sure
yes.
it is a yes.
Next question.
Next question.
Now this one is a
Now this one
bigger
is a
question.
bigger
I'm not going to
question.
read
I'm
it
not going to
because
read it
otherwise you will
because
get
otherwise you will
clue.
get clue.
But I want to
But
see
I want to
a very
see a
fast and
very fast
smart
and
answer by
smart answer
you
by
guys. Actually,
you
this is
guys.
a
Actually, this is
very
a
interesting
very
question,
interesting question,
and I want
and
a quick
I
answer
want a
from you
quick answer
guys.
from you guys.
Your time
Your
starts now.
time
You have
starts now.
one
You
minute
have one
to
minute
answer this
to
question.
answer this question. Okay, A, B, E, lot of answers we are getting. So like a mixed reactions we are getting. So we picked up, which is in, and now question is how many of you get a bamboo
in the
in
first
the
hand.
first hand?
Now,
Now,
did anyone
did anyone
in this
realize
question
in this
patient
question patient
is suffering with
is
acute
suffering
gout?
with
Everyone
acute gout?
understood
Everyone
that.
understood that.
But did you also
But did you
realize
also
your patient
realize
is
your
having
patient is having
some sort of
some
gastric
sort of
ulcer?
gastric ulcer?
Now the question is
Now
if
the
you have a
question is if
gastric
you have a
ulcer,
gastric ulcer,
while many of
while
you
many of you considering
something else,
something else,
like
yeah,
A
like
or
A
D,
or
meaning
D,
like
meaning like
E.
E.
So this one is a
So this one is a
colchicine.
colchicine.
So this one
So this one
is a
is a
colchicine.
colchicine.
Everyone clear about
Everyone
this
clear
one?
about this one?
Now the patient is
Now the
also
patient is
having
also having
diabetes. So is
diabetes. So
prednisolone
is
is a good
prednisolone is
good
a
idea.
good idea?
Your patient is
Your
having
patient is having
diabetes. Please
diabetes.
check
Please check
poor glucose
poor
control.
glucose control.
So is that
So
wise
is
to
that
give a
wise to give a
prednisolone, of course.
prednisolone, of course?
Okay.
Okay.
Clear now?
Clear now?
So it's a
So it's
ulcer
a ulcer
and the diabetes.
and the
So
diabetes.
ulcer
So
and the
ulcer and
diabetes.
the diabetes.
All right.
All
So
right.
how do you feel
So how do you feel
after
after
making
making a
silly mistake?
silly
Not
mistake?
silly. I
Not
mean,
silly. I
you got
mean,
tricked
you got
actually.
tricked.
You are good
Actually,
with the
you are good
concept,
with the concept,
but it's
but
just like
it's
they
just
just
like
tricked
they
you.
just
So
tricked you.
MC always
So
keep
MC
trying
always
this thing.
keep
The
trying this
same
thing, the
type of
same type
question.
of
They
question.
just try to
They
trick
just try
you.
to trick
Same
you.
questions, like
Same
same.
questions, like
Trust
same.
me.
Trust
Same
me.
type of
Same
questions will
type of
come, and
questions
they
will
will
come,
come
and
up with
they will
a
come up with
new
a
problem
new
now. Actually,
problem now. Actually,
yeah.
yeah.
Yeah, but yeah,
Yeah, but
one
yeah,
person
one
mentioned the
person
question is
mentioned the
actually
question is
solid
actually
question
solid
actually.
question
Yeah,
actually.
because some
Yeah,
of the
because
reports
some of
are
the reports are
fractionated. This is
fractionated.
a solid
This is a
question and
solid
lot of
question and lot of
twist and turn.
twist and turn.
So it's like a
So it's
movie,
like a
action,
movie, action,
everything was
reaction,
there.
everything was
Okay,
there.
patient
Okay,
on gout
patient on
already on
gout already
colchicine
on
and albumin,
colchicine and
serum
albumin,
urate
serum
is normal,
urate
no
is
renal
normal, no
failure,
renal
but
failure,
now
but now
inflammatory gout attack.
inflammatory
What to
gout
do
attack. What to
next?
do next?
So first of all, we need
So
to
first of all, we
control
need to control
the acute gout
the acute
condition.
gout
So
condition. So
indomethacin.
indomethacin.
So you need to control
So
the
we need to
acute
control the acute
attack
attack
by giving an
by giving an
indomethacin actually.
indomethacin actually.
Do you agree
Do you
that
agree that
indomethacin is one of
indomethacin
the
is one of the
initial gold
initial
standard
gold
for
standard
the
for
gout
the
cases?
gout
Yes.
cases? Yes.
So if there is no
So if there is
applications
no
like renal
applications like
failure,
renal failure,
and if there is an
and if
acute
there
gout,
is an
that is one
acute
of the
gout, that is
best
one of
drug
the
in
best
the
drug
beginning.
in the beginning.
Okay, this one is a
Okay,
handbook
this one is a
question,
handbook
and
question,
I
and
brought that
I
one.
brought
Let's
that one.
see
Let's
this picture
see this
first.
picture first.
What do you see?
What do you see?
It's a little hazy
It's a little
picture, but I
hazy
can
picture,
make a
but I can
diagnosis
make a
still.
diagnosis still.
So redness,
So
swelling.
redness, swelling.
Okay, now
Okay,
read this
now
question,
read this
please.
question, please.
Let's go,
Let's
guys.
go, guys.
Yourself.
Yourself.
ACE, lot of people
ACE,
will
lot of people
confuse.
will confuse.
Okay, since it's a
Okay,
handbook
since it's a
question,
handbook
it's
question,
also
it's
test for
also
you
test for
to
you
know
to
that
know
whether you have
that
gone
whether
through
you have
handbook
gone through
properly or
handbook
not.
properly or not.
Final answer
Final
is a
answer
E
is a
correct
E
answer
correct
actually.
answer actually.
Final answer
Final answer
as per
as per
MC handbook. So for
MC
this
handbook.
one, you
So
need
for
to
this
open
one,
the
you need to
handbook.
open the handbook.
Okay, I'm not going for
Okay,
a
I'm not
detailed
going for a
explanation,
detailed
but you're
explanation,
supposed
but
to
you are
answer this
supposed
one
to answer
correctly.
this one correctly.
So this is a test
So
of
this is a
your,
test
the
of your,
numbers I
the
have given.
numbers I have
So
given.
this is a
So
test
this is
of
a
your,
test of your.
yeah, see, that
Yeah,
means
see, that means
some preparations
some
are not up to the
preparations are
mark.
not up to
So
the
you need
mark.
to work
So you
hard
need to work
on that
hard
one because
on
this
that
is
one because
supposed to
this
be
is
a
supposed to be a
known one.
known one.
Explanation,
Okay,
please check there.
explanation,
I'm not
please
going
check
for
there. I'm not looking
explanation
for
for this.
explanation for this.
So for explanation,
So
I
for
want you,
explanation,
those
I
of you
want
made
you, those of
mistakes,
you
I
made
want you
mistakes,
to
I want you
open
to
the book,
open the book,
handbook.
handbook.
Yes, I think
Yes, I think
it's fair. I think I
it's fair.
have
I think I have
simultaneously given the
simultaneously
handbook
given
now.
the handbook now.
Now,
Now,
for that
for
purpose,
that
please open the
purpose,
book
please
and see
open
the
the book and see
explanation.
the
Okay.
explanation.
Next
Okay.
question.
Next
61
question.
year, the history
61 year,
of
the history of
liver problem
liver
and gout and
problem and
emergency
gout
of
and
neck
emergency of
pain, swelling
neck
right
pain,
knee,
swelling right knee,
fever and chill for
fever
past
and
40
chill for
terms.
past 40
This
terms. This
temperature
is temperature.
investigation is
Investigation
given
is
this.
given this.
What is most
What is
appropriate
most
immediate
appropriate
management?
immediate management?
Okay, this
Okay.
is excellent
This is
by
excellent by
our dear
our
doctors.
dear
You expert from
doctors. You expert
excellent on
from
this
excellent
question.
on this question.
So,
So,
what we could
what we
see,
could see,
acute pain and
acute
swelling.
pain and
Anyone can
swelling.
tell me the
Anyone can tell me
diagnosis. We
the
do have
diagnosis.
a
We do have
pain,
a
we do
pain.
have
We do have
tenderness, we do have
tenderness. We do
swelling,
have swelling
and this that.
and this that.
So,
So,
based on that
based
one,
on
I
that
think it's
one, I
a
think it's a
septic arthritis. We
septic
discussed
arthritis.
that
We
one
discussed
earlier.
that one earlier.
So,
So,
joint aspiration is
joint aspiration
important.
is important.
Joint aspiration
Joint
later followed
aspiration.
by
Later
there will
followed
be an
by there will be
antibiotic.
an antibiotic.
Just aspiration
Just
is very,
aspiration
very
is
important
very,
here.
very important here.
Good.
Good.
Okay, this is
Okay, this
important
is important
as you can keep it
as you can keep it
as a
as
slide.
a
You can crop it
slide. You can
later.
crop
For
it
now, you
later.
can take a
For now, you can take
screenshot.
a screenshot.
And
And
the
the
screensaver in your
screensaver in
mobiles.
your mobiles.
Okay, so this
Okay,
should
so this
be
should be
kept as a
kept as a
screensaver
screensaver
until you clear
until
with the
you clear
MC.
with the MC.
Do you agreed?
Do you agreed?
Yes. It's okay. I
Yes.
mean, if
It's
you have
okay. I
a
mean, if you have a
your
your
loved one picture in
loved
the
one
screen,
picture in
that's
the
okay. You
screen,
can
that's
make
okay.
it
You can make it
in that case
in
your
that case your
background picture.
background
Okay.
picture. Okay.
In that
In
case, actually,
that case, actually, I mean,
uh,
uh,
we need to be
we need
focused.
to be focused.
We need to focus.
We need to focus. So,
So whichever,
whichever,
and you
I
can
mean,
also take a
and you can
print
also
out.
take a
Whichever
print out.
done, you
Whichever
can give
done,
a
you can
cross.
give a cross.
I'm sure one
I'm
day
sure one day
you can
you
cross
can
or tick
cross or
all
tick
of that
all
actually,
of that
right?
actually,
Like
right?
MCQ,
Like
clinical,
MCQ,
English
clinical,
test,
English test,
registration,
registration,
job,
job,
securing a job.
securing a job.
Yeah, inshallah, you
Yeah,
all will be
inshallah, you
there.
all will be there.
Trust me. I mean, this
Trust me.
is
I mean,
going
this is
month,
going month, uh,
June,
June,
right?
right?
Um,
Uh,
by next year,
by next year,
probably in the
probably in the
February, March,
February, March,
some
maybe
of you
some
even
of you even
enter into the job
enter into the
market,
job
and if
market,
not,
and if not,
again into the next
again into
June.
the
There's a
next June.
two,
There's a two
times people apply
times
for
people
job
apply
more.
for
One is
job
that
more. One is
February,
that
March
February,
is the
March
first
is the
round.
first round.
We call it
We
often
call it
JMO
often
campaigning.
JMO
If you want to
campaigning.
Google
If you
it
want to
later
Google
after
it
class
later
today,
after class today,
JMO
JMO
campaigning,
campaigning,
in February.
in
You
February,
can
you
check it.
can
And one
check
more
it. And
small
one
tip:
more small
there's a
tip:
website
there's a
called
website called Indeed
Indeed.com.
dot
Some people
com.
ask me, doctor,
Some
is
people
there
ask
a
me, doctor,
job
is there
left? You
job
can
left? You
check
can
this website.
check this
They,
website. They
offer so many
offer
jobs
so many
actually
jobs
in
actually
Indeed.com.
in
Actually, it's not
Indeed.com
only
actually.
for
It's not
the
only for
doctors,
the
but
doctors, but
other jobs are
other
also
jobs are
available,
also
medical
available,
related.
medical related.
Yeah.
Yeah.
So here is the
So
thing.
here is the thing.
One more
One
small
more
tip for
small
some of
tip
the
for
people
some
who
of the
are
people who are
already staying in
already
Australia
staying in
because you
Australia because
already
you already
migrated because of maybe
migrated because of
marriage
maybe
or
marriage
maybe because
or
of a
maybe
study or
because of a
whatever
study or
purpose.
whatever purpose.
If it is
If
possible,
it is
my dear
possible,
doctors,
my
if
dear
it is
doctors, if
possible,
it is
you
possible,
can be
you
doctor's
can be
assistant,
doctor's
physician's
assistant,
assistant,
physician's assistant,
a GP
a
center
GP center
receptionist. But
receptionist.
trust me, they
But
don't
trust me,
judge,
they
they
don't
don't
judge,
mind
they
at all.
don't mind at all.
They really don't.
They really don't.
Actually, rather
Actually,
than
rather
they
than
always
they
try help
always
you.
try help you.
Actually, and
Actually, and
another
another
benefit would be
benefit would be
that if
that
you
if
engage
you
yourself, I'm
engage
talking about
yourself,
those
I'm
who are
talking
living in
about those who are
Australia
living in
not doing
Australia
any
not
job,
doing any job,
because at the
because
time
at
of
the
the job
time of the
you
job
will be
you
asked
will
what
be
you were
asked
doing
what
in the
you were
last
doing in the last
2 years.
2 years.
So in that
So in
case,
that case,
of course,
of
the
course,
class
the
things you
class
can
things you can
explain that
explain
in that
that in that
5 months
5 months
class, you can
class, you can
like
like
150 somewhere
150 somewhere
CPD you can
CPD
get.
you can get.
Yeah. Yeah,
Yeah.
even
Yeah, even
volunteer,
volunteer,
observership, and this that.
observership,
Some
and
people
this that. Some
finish it
people
and then
finish it
they
and then
enter.
they
But if
enter.
you have a little
But if you have a
scope,
little
my dear
scope, my
doctors,
dear doctors,
it will also give you
it will
some
also
money
give you
at the
some
same
money
time.
at the same time.
But more
But more
importantly,
importantly,
some of the
some of the
experience and
experience and
anything which is
anything which is close to the patient dealing or health center gives you more better chances at the time of securing the job. For example, if you're living in Sydney, if you're living in Melbourne, there are a lot of options like in the GP health center, physician's assistant, and this that. Look around, like even in Indeed.com, and you go to some centers in person and ask them, check with some seniors. I'm sure everyone has someone in terms of contacts. Yeah, so that's the thing. A saying goes with the New Zealand. Even in fact, in New Zealand, they appreciate a lot. I remember there was a one of my class monitor Tanni. So later, she was just being the doing symposiums. Even she did security job, and I remember she told me once. And then later she was doing a job. I mean, as a receptionist in a GP center, and she mentioned that she got a lot help. Yeah, from those. Yeah, even same phlebotomy, my dear. You can simply do a simple 3 months degree from the TAFE, the TAFE University in Australia. So very short courses available, and then you can engage yourself. I know so many of my students, like they have done phlebotomy and working. So if you already your destination decided, you are inside Australia or you are just going. So these are some very valuable tips from my side as being quite a bigger expert actually. Yeah. So those can be helpful. There are some of ultrasound thing you can do, but I mean not much highly recommended from my side. Rather than engaging in any sort of job is number one priority. That job, if it's somewhere related to any medical center, this is second priority. Is that clear to everyone actually? I mean, not doing anything, doing something is much better. In Australia, also in our country, there is a little trick and benefit in our countries. Even if you are studying, not working, but you can ask a favorism or favor from someone who is close, maybe can show you that maybe you are working, maybe you join later and ask you for more extension as a paper. Like, I'm not telling that you fake a paper, but maybe you join maybe after 3, 4, 5 months, and maybe some of your senior, maybe a teacher or maybe an institution which maybe you were related or someone related, you can join that one and later can request to give a paper for a little bit more longer time. If you're inside, this in these countries everything is possible, but in Australia it's not possible actually. Last tip, in Australia, I mean, some people will tell you that okay, CPD and twin Chris. Please understand what is CPD by googling it more. Anything which you are doing right now for the purpose of study to get into Australia, all are under the CPD. So which includes the classes you are doing, which includes any training you are doing, which includes any observership you are doing. So all comes under the CPD. Good question. Will they verify? Sometimes actually. Sometimes they might verify. So that's the thing. They usually ask for two recommendations actually. So whoever will sign your recommendation, basically they will email them about you to verify actually. Okay, so they will give you your clarification actually, more detailing. So here is a small tip as well about recommendation. Maybe some of your teacher who is close, I mean in your home country, maybe can give that one for you actually. I mean, if you give something for a too big shot professor who never check their email, so in that case you may miss the golden chance actually. Lecturer job, less prospect because it's academic. If you can show like academic plus you are doing like GP, then it's like a super CV. But only showing like a lecturer job, it's a weak CV. You understand what I mean, my dear? Yeah. So it has to be anywhere near the clinical. Academic is like you're just doing a job. Academic is like just like it doing a job which is close to patient but not real patient. Same thing about pathology as well. It's close to medical, not patient dealing. Clear, everyone? You can add that one as a CPD, as a, like a CPD, or as like you were. It was helpful for your MC, I mean, journey. But anything which close to patient is beneficial. At least you can tell. But any clinical job which deals with patients are more important, particularly if it's more related to like emergency. They have more seats in the emergency. Always remember that. Okay, so I recommend whenever you get a paper, or whenever you guys, some of you are planning to work, you work as an emergency medical officer, or even if you're working as a general or junior medical officer, later you can collect that paper maybe as an emergency medical officer. Maybe great for you. I hope. Yeah, same goes with CCU because it's emergency. ICU, CCU, NICU, all are great. All good. So the remaining recall, but I hope so. In between, some of the suggestions are helpful. Time to time, I mean, I will give you more. Yeah. But smaller, if I give and you work on that one, time to time will be much more helpful. Sometimes, if you want to know more, sometimes you can also open my YouTube channel and just play. Maybe you are washing a dish, or you may be eating something. Just hear about what I'm saying in some YouTube videos about job, or about what to do after MC part one. So you'll always get some information, I guess. Yes. If you want to start something, you can check JMO campaigning. You make a CV probably, and you can open an account on the Indeed.com first. Okay. Good. Understand one thing. This job related thing, you need to help yourself. First, there's a lot of in between companies. They will try, get money from you. Like, okay, we'll help you with CV. We'll help you getting a job and this, that. In most cases, it's too superficial. I won't say it's not helpful, but it's too super. If you see most of my YouTube videos, you'll get an idea rather, I would say. Yeah. Then it's rest is your wisdom and your things, while at the time, because at the same time, you need to apply by yourself. No one is going to exactly apply for you. That is the harsh reality. So the more educate yourself with the time for the job preparation and interviews is better actually. So start early. That's the summary. So start early. Okay. Great. Yeah. Now here is the thing. Painful tender diffusion on the right knee. His plasma UX level is this. His joint expression showing this. With negative Bagai, so here is the question about negative by refrigerants, and you comments Indo medicine, which is for the acute. And of course we always get a dramatic response with indelicate. Same like in a unconscious due to hypocalcemic sugar. It's a dramatic response. Same kind of response here. Real following is the most long-term management. Interesting question. So good long-term management would be here. Let's go and see. Yes. Because painful tender diffusion on the right knee in a person. Joint aspiration and negative guide reference indicating the gout. So ultimately you might need a adopter for the long-term better because they asked about a management, not a lifestyle. Okay, great. So allopedic. This question is also a handbook question, by the way. So this time I brought that explanation. One of them I didn't in explanation. Guys, please open the handbook page numbers previously given in the group. If anyone is a recorded course user, you can check it from your private channel. Great. 45-year-old female came to the emergency room after an episode of hemoptysis. On riffing of the system, she had a chronic fever, sinus infections, weight loss, urine, looking bloody. Okay. So what is the best regimen to start? They just play with words, nothing else. Keyword is a hemoptysis.
and hematuria.
and
So I think
hematuria.
you
So
made a
I think you made a
diagnosis.
diagnosis.
Hemoptysis, hematuria
Hemoptysis,
together. So
hematuria together. So
corticosteroid and
corticosteroid and
cyclophosphamide. It's a
cyclophosphamide. It's
diagnosis.
a
It's a
diagnosis. It's a
OANRs. 2H,
OANRs. 2H,
hematuria,
hematuria,
hemoptysis. So
hemoptysis. So
respiratory renal
respiratory
involvement.
renal involvement.
Some cases they will
Some
mention
cases they
about
will
the
mention about the
CM.
CM. These particular characteristics things
Some
matches.
cases they will
Some
also
cases they
mention
will
about
also
a
mention about a
cavitary lesion in
cavity
the lung.
relation in the lung.
Some cases they
Some
also
cases they
mention
also mention
cavitary lesion in the
cavity
lung,
relation
which
in
is
the lung,
not
which is
mentioned here,
not
but
mentioned
I
here,
have
but
seen
I have seen
another question in
another
past.
question in past.
So high dose of
So high dose of
steroid
steroid
and some
and some
cytotoxic
cytotoxic like
cyclophosphamide.
cyclophosphamide.
Did I show you
Did I show you
previous day there was
previous day there
a
was
chart
a
about the
chart about the
DMARTs guys. This
DMARTs
is
guys.
modifying
This is
anti-rheumatic
modifying
drug.
anti-rheumatic drug.
There was a chart.
There was a chart.
Anyone remembers?
Anyone
Yes.
remembers?
Well,
Yes. Well done.
okay. Next.
Okay.
A
Next.
40-year man
A
comes with
40-year man
morning
comes with morning
stiffness
stiffness,
both wrist.
both wrist.
The pain lasts
The
for like
pain
one
lasts
to
for
two
like
hours.
1 to
That's
2 hours. That's
characteristics. Now
characteristics.
concern
Now
comes with
concern
wrist
comes
pain,
with wrist pain,
and we have some
and
lab
we have some lab
findings,
findings,
and they're asking for
and they're
appropriate
asking for
management.
appropriate
Please also
management.
note
Please
ESR
also note
is
ESR is
75. Looks like
75. Looks
inflammatory.
like inflammatory.
So inflammatory means
So
it's not
inflammatory means it's not
osteoarthritis. So
osteoarthritis.
what
So
do you think? 40
what do you think?
years
40
inflammatory
years
condition,
inflammatory
morning
condition, morning
stiffness. I think
stiffness.
we're
I
going for
think we're going for a
you know
you know
rheumatoid condition.
rheumatoid condition.
And if it's a
And
rheumatoid
if it's a
arthritis
rheumatoid
condition, they
arthritis
ask
condition,
most
they ask
appropriate
most
management.
appropriate
So
management.
most
So
appropriate
most
treatment of
appropriate
rheumatoid
treatment of
arthritis
rheumatoid arthritis
of course,
is,
disease
of course,
modifying
disease modifying
anti-rheumatoid drug.
anti-rheumatoid drug.
Another keyword was
Another
there,
keyword
morning
was there,
stiffness,
morning
more
stiffness,
than
more
1
than
hour, which is
1 hour, which is
characteristics.
characteristics.
And ESR is
And
also
ESR
is
is
because
also
it's
is because it's
inflammatory. No, they ask most
no, they ask
appropriate
most
management.
appropriate management.
That's why it is the
That's why
answer.
it is the answer.
Yeah, if it's in
Yeah, if it's
initial,
in
will be
initial,
asked.
will be asked.
Most cases,
It's
it's possible the
possible the
painkillers.
painkillers.
Excellent.
Excellent.
Now,
No.
so some
So
cases,
some cases,
ankylosing
ankylosing
related
related
question
question
can
can
be
be given as well.
please note,
Please note
there will be six
there will be
teeth.
6 teeth.
Another
Another
differential.
differential.
Another
Another
differential would be
differential would be
ankylosing
ankylosing
spondylitis.
spondylitis actually.
Great.
Great.
Next question.
Next question.
X-ray will be given.
X-ray will be given.
Unfortunately,
Unfortunately, we
we don't
don't
have that X-ray, but
have
we
that
do
X-ray,
have
but we do have
a lot of X-ray
a lot of
finding
X-ray
today.
finding
I mean to
today.
say
I mean to
this
say
bamboo,
this bamboo,
which some of you are
getting
getting
already today.
Anyways, let's
Anyways,
fun
let's
apart.
fun
X-ray
apart.
given
X-ray given
ankylosing spondylitis
ankylosing
scenario, that
spondylitis scenario,
means
that means
there are
some features
some
related
morning
to some
stiffness
morning
for
stiffness
very
for very few
and
minutes,
at the same
and at
time
the same
problem in
time
the
problem
eye,
in the eye,
maybe an X-ray
maybe an
finding which
X-ray finding which showing bamboo spine.
what to do
What
next
to
they
do
ask, which
next?
is
They
a
ask, which is
MRI,
a
which is a
MRI, which is a
HLA-B27. We'll go for
HLA-B27. We'll go for a
HLA-B127.
HLA-B127.
Next, because
Next, because they asked next.
it's a blood test, so
It's a blood test, so
HLA-B27
HLA-B27 will come forward.
Next question.
Next question.
So 54
So 54 answer was
this one D
this
HLA.
one D HLA.
Young girl
Young
presented
girl
with red eye,
presented with
so
a red
looks
eye,
like
so
since
looks like since
chapter and
rheumatological
eye,
chapter
so
and
one of the
eye, so one of the
rheumatological
rheumatological
condition
condition with eye problem,
previously mentioned,
previously
and they
mentioned,
mentioned
and
back
they
pain,
mentioned back pain,
and brother has
and brother has
ankylosing. What is the most
what is the
appropriate
most
next step?
appropriate next step?
So are you going for
So are you going for a
HLA-B27 or are you going
HLA-B27
for
or are you going for a
extra
extra
lumbosacral
lumbosacral
spine?
spine?
Answer,
Answer,
you'll
you'll
go
go
for
for
initial.
initial
This one
one.
is not
This
a
one is
step
not
up.
a step
This
up.
is initial.
This is initial.
Extra
Initial is an
lumbosacral
extra
spine.
lumbosacral
What
spine.
you are
What
expecting
you are
is a
expecting
possibility
is a
of
possibility of
bamboo spines.
bamboo
Actually.
spines actually.
Okay, then we go for
Okay,
a
then we go for a
HLA-B27.
HLA-B27.
Furthermore can be
Furthermore can be
MRIs actually. So
MRIs
initial
actually.
of
So
this one.
initial of
So
this one.
as you
So
can see
as you can
here,
see
so
here, so
X-ray,
X-ray,
and
HLA,
MRI,
and
this is
MRI.
for
This is for
the
the ankylosing
spondylitis.
spondylitis.
5 more questions.
5 more questions.
25-year
complaint of
Raynaud's. I
Raynaud's.
hope you all
I hope you all remember
ANA negative,
ANA negative, ANA
and this
negative, and this
question,
particular question.
yes, it came up.
Yes, it came up.
We brought that
I
question
brought
to
that
make you
question to
understand
make you
earlier, but
understand
this
earlier,
was
but
that
this
question.
was that question.
So in that
So
case,
in that case,
I mean, from the Raynaud's,
from the
we never
Raynaud's,
find
we
a new
never find a
question
new question It's always this question, and one question was regarding the secondary. So it's very similar question always we got so far. Okay, I saw this question keep coming actually. So less than 30, this stuff. So it's all primary brain nodes actually. Remember this one? Less than 30 year. There was no exact symptom of SLE, which is part of the secondary. No autoantibody positive because ANA negative, DNA negative. So this brings us to the point. This is primary range. Everyone clear about this question? So this is the question. This is the differentiating. I hope you remember it. So maybe some of you can take a picture of this one. This one we may not have this slide in the SMA note. Maybe you can have a picture of this.
A tricky question,
Let me ask my dear doctors. If you want to take a vitamin, what vitamin would you like to take?
Yeah, it's recommended.
Yeah, it's recommended because when you are going through the MC,
and lot
a lot
difficulties
we face.
Should I recommend
something for my doctors?
Because I was there.
Because I was there
at some time.
at some time.
Okay.
Okay.
So
I would recommend something Magnesium Pro.
Yeah. No,
Yeah. I mean multivitamin is okay,
but I would
recommend something Magnesium Pro. Magnesium Pro includes magnesium,
which you will get a
which
lot
you
of
will get a
things,
lot of things, a lot of help.
and
And
the same time,
the same time, pro means it includes vitamin C, antioxidant.
It also
It
includes
also includes the vitamin D.
It also
It also includes vitamin
B6 like
B6 like B.
Yeah, so
So I think it's a quite a good combination. So if you are living in Australia, you will find a very good ones actually.
Yeah, Johnny's
Johnny's class depends on your age. Maybe we are
into
into early age group unless you are, as I mentioned, not going through severe workout. You probably don't need the Johnny's class actually.
Okay, if someone's
Okay, if
camera
someone's camera is on,
sure
please make sure
you turn it off.
you turn it off actually. Yeah,
We turn it off.
turn it off.
Yes,
Yes, turn it off.
Okay, next question.
Okay, next question. Yeah, yeah.
Okay, go through it.
Okay, go through it.
Please read it.
Please read it.
Finish it.
Finish it.
Everyone. So
Everyone. So this one is a SLE related case, and as usual in SLE cases,
in
as in basic painkillers, naproxens are given,
and
and probably it's not working in that way. So what's next there? Asking.
So as
per
in these cases, no, this one's not
ankylosing, like,
so that will be
so that will be directly jumping into inflexible. So we do have option like to go for the other DMADs. So my eyes and maybe your eyes are also looking for an alternative option for which one? This is a moderate case of
SLE probably.
So this one looks like a
moderate. So
my eyes and your eyes both are looking for
what?
Hydroxy
But
protein. But did I mention in
some part of
the lecture that sometimes alternative methotrexate
you need to also
you need to also remember. So as alternative,
I have
I have seen this question coming. So where hydroxy may not be mentioned, and this is that particular
So see
question.
why
So you see why the
more
lectures are more important.
So
So methotrexate
is the answer here.
is the answer here.
If we do have
the hydroxychloroquine, I would have picked up that one as an answer. Clear?
Check the SLE part.
Check the SLE part
John
from the
Mehta
John
for
Mehta
further
for further references.
Okay.
Okay.
Specific management
Specific
about
management
SLE,
about
which is
SLE,
long
which
term,
is long
they
term,
just
they
presented in a
just
little
present it in
different
a
way.
little
That's a
different
very
way.
classic
That's a very classic
question. Please pick
question.
up.
Please pick
I
up.
think
I
one of the
think
better
one of the
combination
better
for SLE.
combination for SLE.
Come on, please.
Come on, guys.
So final
So
answer is
final
here.
answer is here.
Okay.
Okay. What do you mean by
Anticoagulants, if I
anticoagulants?
ask you,
If I ask you,
means
means
heparin and the
heparin and the
warfarins. Am I
warfarins.
right, guys?
Am I right, guys?
Anticoagulants means
Anticoagulants means
heparin and warfarin.
heparin and warfarin.
Correct me if I'm wrong.
Correct me if I'm wrong.
So in
Um,
the first
so in
hand,
the
I mean,
first hand, I
should
mean,
we go
should
for
we go for
heparin and
heparin
warfarin
and
if you
warfarin
don't have any
if you
bleeding
don't have any
related
bleeding related
tendencies?
tendencies?
Right.
Right.
I feel like that's
I
for the
feel like that's
different
for the
purposes.
different purposes.
But if you have a
But if you have a
pre-existing atrial
pre-existing
fibrillation
atrial
or a
fibrillation or a
pre-existing bleeding
pre-existing
condition,
bleeding condition,
rather than
rather
can we
than
say like
can
this?
we say
SLE
like this?
has a
SLE has a
long-term problem.
long-term
Like what?
problem. Like
Last
what?
day I mentioned
Last
this
day I
thing.
mentioned
SLE
this thing.
related to
SLE related to
antiphospholipid,
anti-phospholipid,
and
and
particularly SLE and
particularly SLE and 1
1-phospholipids, more
phospholipid,
related to
more related to
thromboembolic
thromboembolic
manifestation, which is almost
manifestation,
like
which is
30
almost like
times
30 times
more than
more than
the other
the
situation.
other
So
situation.
is
So, is
anticoagulation which is related to
anticoagulation which is
bleeding
related
is
to
more
bleeding is
appreciated
more
here, or
appreciated here, or
giving an
giving an
aspirin and
aspirin
prevent
and
the future
prevent the
strokes
future
are more
strokes are
appropriate
more
here. So I
appropriate
think
here. So I
the
think the
antiplatelet,
antiplatelet, like that is that aspirin,
appropriate those kind of
appropriate
things
those
are
kind of things are
more appropriate
more
here. Do you
appropriate
agree
here.
on this,
Do you
guys?
agree on this,
So an
guys?
immune
So an immune
suppressive,
suppressive,
yeah,
yeah,
and this
and this
antiplatelet or the
antiplatelet, the
anticoagulation is
anticoagulation
more appropriate
is
here.
more
Okay,
appropriate here. Okay.
almost here at the
Almost
end.
here at the
A
end.
similar
A
question
similar
related to
question related to
Raynaud's, but
Raynaud's,
look into
but
it.
look into
Is
it.
it the
Is it
primary
the
or is
primary
it
or is it
the similar
the
cases? Now,
similar
in this
cases? Now,
one,
in this one,
we will go with this
we
one
will go
with
with
a
this one with the
ANA positive,
ANA positive,
and they do
and
have
they do have
even not
even
only exposure
not
to
only
cold,
exposure
but
to cold, but
some pneumonia
some
things.
pneumonia
But
things.
it's
But
also more
it's
than
also
30,
more
more than
than
30
30 ANA
antibody positive.
antibody
So
positive.
did you
So did
find
you
some
find
differences
some
compared to
differences
the
compared to the
last one? But
last
I
one?
think in the main
But I
exam
think in
they
the
will
main
give you
exam they will
one
give you
more
one more
or
or
additional
two more
point
additional
regarding the
point regarding
SLE
the
as well.
SLE as
I
well.
think so.
I think so.
So
So
autoantibody positive,
autoantibody
age is
positive,
covering,
age
and
is
also like
covering,
a
and also
pneumonia
like a
things.
pneumonia
But
things.
even though
But
one
even
two
though one
features of
two features
SLE
of
is more
SLE is
appreciated
more
here.
appreciated here.
So this
So
one we are
this
going for the
one we are going for
secondary.
the
Everyone agreed
secondary.
with me.
Everyone agreed
This
with
one
me. This one
compared to the last
compared to
one,
the
I
last one,
think
I
D
think
is a better
D is
answer.
a better
Now,
answer.
why I
Now,
didn't
why
pick
I
up
didn't
the
pick
A?
up the
That
A?
can be a
That
question
can be a question
because A
because
is
A
also
is also
secondary.
secondary.
Now, A is
Now,
also
A is
secondary.
also
Now, why
secondary.
I
Now, why
didn't
I
pick up
didn't
the A
pick
in
up
that
the
case?
A
The
in that
answer for
case? The
this one,
answer for this one,
SLE
SLE
is most
is
common
most
cause of
common cause of
secondary Raynaud's,
secondary Raynaud's,
70% of
70%
cases.
of cases.
So some cases
So
when you
some
are not
cases when we are
sure
not sure
which one,
which one,
then we pick
then
up
we
the
pick up
most
the
common one.
most common one.
So sclerosis
So
is also
sclerosis is also
is an answer,
is an
but
answer,
SLE
but
is
SLE is
70% of
70% of
secondary cases are
secondary cases are
SLE. Clear?
SLE.
I hope it's a
Clear?
better
I hope it's a better
explanation.
explanation.
Okay. Why not
Okay. Why not
cryoglobulinemia?
cryoglobulinemia?
Cryoglobulinemia almost always
Cryoglobulinemia almost
associated
always
with
associated with
hepatitis C virus.
hepatitis
So
C
if you ever
virus. So
see the
if you ever
hepatitis
see the
C
hepatitis
and a
C and a
systematic
systematic
presentation
presentation
and Raynaud's,
and Raynaud's,
so Raynaud's and
so
hepatitis
Raynaud's and
C, it
hepatitis
will
C,
be
it will be
cryoglobulinemia. Clear,
cryoglobulinemia.
everyone?
Clear, everyone?
Okay. Next,
Okay. Next,
almost at the end.
almost at the end.
After one more.
After one
Picture
more.
of a female
Picture
with
of a
SLE with
female with
malar
SLE with
rash.
malar
Okay,
rash.
diagnosis of
Okay,
choice. I
diagnosis
think
of
it's
choice.
an
I think
easy one.
it's easy
No
one.
anti-DS
No
DNA.
anti-DS
If
DNA.
no anti-DS
If no
DNA, then
anti-DS DNA, then
anti-Smith.
anti-Smith.
I mentioned this
I
thing
mentioned this thing
last day.
last year. Yeah.
Tricky one actually.
Tricky
This is a
one actually.
tricky.
This is a
Often
tricky.
many
Often
people
many people
confuses this one.
confuses this one.
So B was the
So B
answer.
was the
Yeah.
answer. Yeah.
Okay.
Okay.
Here's a feature given.
Here's a
It's a
feature given.
pediatric
It's a
question
pediatric
actually.
question
With
actually.
a child with
With
a
a
six
child with a
days
6 days
rash. So
rash.
fever comes
So
first,
fever
then the
comes
rash
first, then the
and
rash and
desquamation and
desquamation and
lymphadenopathy. I
lymphadenopathy.
think
I think
from some of your
from some
MBBS
of your
knowledge, you can
MBBS
also
knowledge, you
answer
can
that
also
one.
answer that
It's not
one.
so difficult.
It's
So
not so
child with
difficult.
a
So child
rash
with a
and
rash and
desquamated rash, it's a
desquamated rash, it's
Kawasaki
a
disease, and they're
Kawasaki
asking
disease,
about
and they're
initial
asking about initial
investigation. This
investigation.
is
This
somewhere
is
one of the
somewhere
pediatric
one of the
question popped
pediatric
up
question
here,
popped up here,
but it's
but
okay.
it's okay.
So our final
So
answer
our
is a
final
yes, sir.
answer is
Here,
yes, sir.
initial.
Here, initial.
Initial is a
Initial is
yes,
a
sir.
yes, sir.
Okay. So
Okay.
initial
So
is
initial
yes, sir.
is
Best
yes,
would
sir.
be
Best would
echo.
be echo.
Today's last question.
Today's last question.
3-year child with a
3 year
5-day
child with a
fever.
5 day
Same type
fever.
of
Same
question with
type
a
of question with a
lymphadenopathy.
lymphadenopathy.
Now asking about
Now asking
management.
about management.
Just
Just
little modification
little
of the
modification of the
options.
options.
Which one looks
Which one
better?
looks better?
Um,
Um,
appropriate management.
appropriate
So I
management.
think
So I think
IVIG is one of the
IVIG
best
is one of
thing
the best
for
thing
the
for the
Kawasaki. So if that's
Kawasaki.
in
So
the
if
option,
that's
there's a
in the
higher
option, there's a
chance
higher chance
that can be a
that can
answer.
be
I
answer.
repeat
I
again,
repeat
IVIG
again,
is the best
IVIG is the
treatment for
best treatment for
Kawasaki disease.
Kawasaki disease.
So
So
immunoglobulin, aspirin,
immunoglobulin,
and EPO.
aspirin, and EPO.
Right.
Right.
Okay, we do have, I
Okay, we
think,
do have, I think,
anti-DS DNA
anti-DS
positive. Okay.
DNA positive. Okay.
Mm.
Mm.
Now this one,
Now
why we
this
picked
one, why
up
we picked up
probably
probably
anticoagulation. Let's just
anticoagulation.
check.
Let's
Okay.
just check. Okay.
This one, why we
This
picked
one, why
up
we picked
one,
up one,
not two.
not two.
Previous one of the
Previous
similar
one of the
question we
similar
picked up
question we picked up
two
two
antiplatelet and immune
antiplatelet and
suppressant.
immune suppressant.
But are they the
But
same
are they the
question?
same question?
Here,
Here,
do we have some
do we have
bleeding
some bleeding
incidences happen?
incidences happened?
Vascular event
Vascular
happened or
event
not?
happened or not?
So here
So
vascular
here
event happened.
vascular event
So
happened.
here we
So
need
here we need
this
this
anticoagulation support
anticoagulation
like that.
support like that.
High
High
possibility,
possibility,
initially heparin
initially
and
heparin
later
and
warfarin,
later
right?
warfarin, right?
Initially heparin,
Initially heparin,
IV, and
IV,
later the
and later
warfarin.
the warfarin.
Yes.
Yes.
All right.
All right.
All right.
All right.
Thank you so much,
Thank you so
guys,
much,
for
guys, for